After ng mammogram, doon nakita na mayroon akong maliit na bukol. Kinonfirm pa yun sa ultrasound hanggang sa nakita nila na kumalat na sa lymph nodes ko. Masyado po akong na-depress. Kasi wala po akong, wala akong kasama magpagtulog. Hindi ko po alam kung anong gagawin ko. Yun, depressed po ako. In the middle of the night, nagigising po ako. Hindi ko po alam kung makakasurvive ako kahit na may medication naman. Sabi ko lang, bigyan niya ako ng time na mabuhay. Yun lang. Kasi po, ang dami ko pang gustong gawin na late na dapat nagawa ko noon, hindi ko pa nagawa. Na-schedule po yung pag-opera. Tapos after nung sabi na stage 3 nga, sabi ng doktor ko magpa-chemo. Actually 8 cycles po ako. Pero at the end of my 5th cycle, nag-internal bleeding po ako. So last May 28, naging critical po kasi hindi ko alam na 10 bags na pala yung nawala sa akin. Last 2 chemo ko, masyado pong malakas yung gamot na niya yung stomach ko. So yung hemoglobin ko naging 5. It was the doctor who stopped the chemo. Nang diagnose po ako, yun, nag-start ako na uminom ng ImuRegen. Yung every meal, yun ang iniinom ko. Hanggang po, sa ngayon, hindi ko po tinigilan yun. Sa ospital, naging 60-40 na po yung blood ko. Sabi ng doktor, kailangan ka na kasi 10 bags na yung nawala sa iyo. Sabi ko, hindi ako magpapa-blood transfuse. Sabi niya, mamamatay ka. Yung cardiologist ko po, ayaw kong iwanan. Sabi niya, because you had a heart attack, walang ibang mangyayari kundi ma-heart attack ka talaga, sabi niya. Sabi ko, kahit na magsasign ako ng waiver. Yung masasabi ko lang po sa may mga cancer na katulad ko, maging positive lang sila at saka wag silang bumitaw sa Diyos. Siya kasi yung may-ari ng buhay natin. Maraming yung food supplement ngayon, but piliin na ng tama na pwede makatulong talaga sa kanila.
My name is Jorge. I'm a nurse. 2 years ago, I was diagnosed with a brain tumor. My doctor has told me I'm just going to live 6 months. It's when I start taking ImuRegen, the liquid, which has helped me a lot, improve my immune system. It looks like I have more energy to work, perform better at work. Also, my whole family was diagnosed with COVID 3 months ago. They were able to, all of them made it, They have they start the liquid and glucan plus, the capsules. Myself, I was also diagnosed with COVID 3 weeks ago. I went back to work within 8 days since I was already taking ImuRegen liquid, so I was able to perform faster at work, and I feel like my symptoms were not that much of a I didn't feel the symptoms, so I was until like I stopped taking ImuRegen for 2 days while I was with COVID. I felt some symptoms, then I went back to ImuRegen, the liquid and the capsules, and it seems like I was able to get negative results within 8 days of using this product. So that's my testimony, about ImuRegen.
Hello, my name is Michael Martin, and I'd like to tell you about a product that I started on 3 weeks ago. First, let me tell you that up until I was 70 years old, I was in perfect health. Then I came down with cancer. I was able to use some nutritional products and overcome it, but 2 years later, I came down with cancer again. This time I had to do chemo. I also had a problem with my kidney. My kidney was at stage 5 kidney failure, which means I had to go for dialysis. Again, I was able to overcome that, so I didn't do dialysis, and I got my kidney up to about 30%.
Sige na.
But in the process of the cancer and the kidney failure, I lost
Tignan,
65 pounds.
tignan mo nga kung may live si
I was down to
Francis Tira sa ImuRegen
113
about
pounds
cancer.
and I'm 6'1". I was a candidate for a fill-in at a Holocaust movie. I didn't look very good. I had no
Bye.
strength. I lost all my muscles.
2:30.
I had to do a walker. I wasn't in very good
Kita
shape.
man nag-live na.
I also had to go on a
Nag-live
catheter
afterwards mo kami.
because using a walker and no strength in your legs, it was difficult for me to get up every hour and a half to urinate. So I wound up producing about 2,000 cc's of urine every night. November 17th, I was introduced into this product. On November 19th, I started taking it. After 1 week, the volume of my urine in the bag reduced to 1,000 centimeters. A couple days later, it was 800, and then it was 700, and by the end of the second week, I was off the catheter and able to just urinate, get up once a night, which I can live with. The other thing was, because I lost all of the muscle, my strength was just very low. And I could only work and concentrate for a couple hours each day. Once I went on the product, my energy levels have increased. I now am working 12, 14, sometimes 16 hours a day without any problem. Yesterday I went up and down my stairs at the house 10 times with no problem. The energy I'm feeling, the strength in my legs are tremendous. All I can say is in 3 weeks, this is a miracle. Your body is in fact a miracle. If you give it the right nutritional products, it can do wondrous things. I strongly encourage you to get with the person that sent you to this and take a look at our incredible product. Forever Healthy Products out of the Philippines. The name of the product is ImuRegen. Please take your time and give us a real serious look. Thank you for your time.
Hi everyone, I'm here with me, one of the users of ImuRegen. Well, I requested him to do this short interview because his story was one of the stories that struck me and really called my attention on this product. Okay, his name is Caleb, is it?
Caleb.
Okay,
Yes.
Caleb, you were just telling me that you had this event.
It was a heart event, and my heart actually stopped for 14 seconds, which was really, scary. Obviously,
Okay, this was October, yeah?
that was in October, around the 18th or so.
Okay.
But after that, I was really severely weakened, so I wasn't able to walk very far, maybe 25 paces or so, in and out of a wheelchair. Couldn't talk very strong, not very long. It was just draining me, taking too much energy. Doctors really didn't have anything to give me. I'd asked them for some things for that, and they just asked me if I had shortness of breath, if I was, no, I'm not dizzy in the head, no, I'm just weak. So around Thanksgiving Eve, I get a call from a business associate, and he says that there's been a product that's here from Europe that actually repairs your DNA.
Okay.
So when I heard that, I said, boy, if I can get a hold of that, that sounds like exactly what I need. I
Okay.
said, so how do I get it?
Yeah, excuse me, sir. So, the doctor's diagnosis on you was your heart stopped.
Heart stopped pumping for 14
So, okay,
seconds.
were there any indication that there's a heart problem or
Well, they
blockages or
say-
what?
No blockages, but it's a part of your heart called the sinus node.
Okay.
And that is like a starter in your heart. Everyone has it. And so if your heart rate suddenly drops for any reason. You know, you may be holding your head down, or you may be someone swinging you around. It happens all the time. But when your heart rate drops drastically, this sinus node, this starter in the heart, kicks in and brings your heart rate back up to its normal position. That normally happens, a doctor say, in about a second or a second and a half, no more than 2 seconds. And in my case, it was 14 seconds before it kicked in. He said, wow, that is really scary, way too long.
How old are you, sir?
68.
You are 68.
Yeah.
Okay, so, ImuRegen was introduced to you.
Thanksgiving Eve, the day before
Were
Thanksgiving.
you taking any medications during your...
No, I was not taking any medications.
Okay, so you were weak then. You were feeling weak. Everything was not normal after that event.
It wasn't normal, no. I wasn't able to walk. I wasn't able to talk that well.
Okay.
I was very weakened. That's what I was trying to tell you.
Yeah.
You know, after the event, I was left in a very, very, debilitative state. So I was looking for a way to get back on my feet. And so when I got the call about the ImuRegen, you know, I got it the next day on Thanksgiving Day, began to take it, and about a week later, I'm up and I'm walking. You know, I'm talking, I'm stronger.
That's a week later.
Yeah, it's no more than 5 to 7 days. You know.
Okay, so how much were you taking then?
I was only taking about at that time 1 teaspoon per day. I was taking one. I was taking 2 of the glucans.
Okay.
And I was taking 1 of the Immune Plus capsules.
Confirm
Okay.
pa
I
yun
didn't
sa
have the
ultrasound.
fulvic. They didn't have any fulvic at the time. So I was just taking those 3 products, you know, every day, and boom, you know, it began to quickly accelerate into some real energy for me, real power. And so after that, I began to tell people about it, obviously, and other people wanted to get involved and get in that sort of thing. And so
This was recommended, if I do remember it right, this was recommended to you by your chiropractor.
No, it was recommended to me by Dennis Gray. You know,
Oh,
he's
okay.
a business associate of mine.
Okay.
He called me up to tell me about this product. He called me up to tell me about it from a marketing point of view.
Okay.
But at the time, I said, Dennis, I'm not interested in marketing anything. I'm only interested in getting able to walk.
Getting back your health, yeah.
Exactly. So
Okay.
I said, I don't care about that. Just tell me how I can get some of the product. So he told me that there was going to be a meeting on Thanksgiving Day and Carson, California. So I said, okay, I'll drive down. And I did that, got the product. I did run out that very same day. And I very same day. Now, after I had been involved for about 3 weeks, you know, we ordered a lot more of the product, and I began to take, for 1 month, I took 2 teaspoons per day, you know, and so I did that for a month, and then I cut back to now, it's just back to 1 teaspoon per day. I take the capsules now. I take 3 capsules a day.
Okay, any parting words, sir, with regards to the product? Especially...
Well, here's the key with the product, you know, and it was just what my spirit told me when I first heard about it. Once your DNA is repaired, okay, the body knows what you are dealing with. Everyone deals with something different. Some people might have a kidney situation. Some might be a high blood pressure. Others might be diabetes, might have a heart condition, maybe cancer. We're not addressing any of those issues. What we are addressing is your DNA. Because if your DNA is repaired, the body already knows what you need, what you specifically need. Different people need different things.
Everything goes to homeostasis or balance, yeah?
Exactly. So it's only going to go to what you need. And so that way we can take the same product, but it might address 2 different issues.
Okay.
One issue in you might be kidney, another issue in me might be the heart.
Yeah.
You see? So that's the real key to this thing. That's why it's so powerful.
Okay, thank you very much, Mr. Caleb, for this short interview.
Yes.
Again, the intention is to share this for those people who badly needs help, okay?
Exactly.
Okay,
All right.
more power to you and God bless.
Thank you.
Okay.
Bye-bye now.
The other days, when I went here, Sir Leon gave me a bottle of ImuRegen with glucan. So, the next day, somebody called. Nasa ospital po kami, nasa St. Catherine. St. Catherine is almost 30 minutes to 40 minutes from my place. Ganun siya kalayo. I need help because the platelet of my son is already 53. 56, nag-53. Sabi ko, anong gagawin ko? Wala naman ako maano. Tapos I remember oh nga pala, there is ImuRegen. Sir Leon gave ImuRegen. So I took 10, just 10. Just 10 ha. Sabi, because I know, I'm confident that something will happen. Sabi ko, sobra na nga yun eh. Kahit every hour ko yun, alam ko naman may mangyayari. So, 10 capsule lang ang sinama ko, ang binigay ko sa kanya, nilagay ko sa Ziploc. Tapos I went to the hospital and gave it to the mother. Sabi ko lang, bigyan mo lang siya 1 capsule every hour. Kasi habulan eh. Eh gusto nila makalabas na kasi they've been there for 5 days and the problem of the mother is paiinumin nila ng gamot. Ang iniinom lang daw is vitamin C and paracetamol if there is fever. Eh hindi pwede dun sa bata kasi may complications yung bata. So yun lang daw at saka sabi ko ano pang binibigay? D5-LRS, suero, dextrose. So sige. Kaya lang Doc, nandito na kami Sunday, Monday, Tuesday, Wednesday, Thursday, Friday. Anong araw na? Saturday na. Mauubos na yung bala. Naaawa ako. I pity the mother. My heart is with her because I know she's also going through a lot of things because she has cancer of the goiter. So sabi ko, ang bigat para sa mother. I know how she feels. So sabi ko sa kanya, sige, I'm going there. Give me at least 30 to 45 minutes. Andyan ako. But I will not stay long kasi iwan ko lang kasi late night na yon. So binigay ko sa kanya yung basta, round the clock. When you say round the clock, walang palya. So 10 hours, alam ko 10 hours yon mula nung oras na yon hanggang the next day. Tapos sabi ko 6 o'clock, what was the latest? Sabi ko, what's the latest platelet count? From 53, nag-shoot up siya ng 110. So sabi ko, good. Sabi ko, how many capsule do you still have? Sabi ko ganon. So expected ko, meron pa kahit dalawa. Sabi niya, meron pa po yata dalawa or parang 3 pa, sabi niya gano'n. Sabi ko, sige, ngayon ibigay mo na yung 3. Ay! Hindi kaya ma-overdose, 3 kaagad. Ibigay mo na ngayon yung 3 para makalabas ka ng alas 12. Kasi cut-off ng ospital is 12 o'clock. So pag 12 o'clock, hindi yan bumalik, hindi pumalo ng normal yan, hindi ka makakalabas. Plus 1 day ka. So ibigay mo na lahat yan para pag extract ng blood ng 8 o'clock, makikayos na yung dugo mo, makakalabas ka na alas 12. So, she gave the last 3 capsule, and after that, it was already 284. And they were sent home at 12 noon. Imagine, 10 lang yun, 10. It is documented. Because it is from St. Catherine Hospital in Angeles City. There is full documentation from day 1 up to, although it's not documented there, it's not in the drug report that ImuRegen was given. Kasi talagang hindi naman dahil sa akin nang galing. It's not from the hospital. But there is, kasi bawal yun. It's not from the hospital. But the mother and the son, the family can attest that it was given. Kasi ako rin naman, alam kong binigyan ko ng 10 capsule yon and it worked talaga. So even now, the mother was telling, ano nga ba yung binigay mo? Ano nga ba yung binigay mo? Sabi ko, that's ImuRegen. Sabi niya, paano yun? Saan ako makakuha? Baka naman pwedeng makatulong din sa akin yon. Sabi niya, nakausap ko siya. I was talking to her yesterday. And she was, ano yun? Ano ba yung binigay mo? Ano ba yung binigay mo? Kasi syempre hindi niya matandaan yung name. Sabi ko, bakit? Kasi ang ganda nun eh. Kahit nga yung doctors nagtaka. Nagtaka yung doctors na in a short span of time, the blood was normalized. Everything was okay and there is no sign of any blood transfusion to be done in less than 12 hours. Okay? So, ganun ang nagiging effect when it is on the cellular level po.
Nung una po, naiiyak ako. Kasi sabi ko, hindi mo pa kinuha. Hindi mo pa ako pinabayaan na disable yung may tukod. Pinalakad mo pa ako. Yun po yung nasa isip ko. Mahilig akong magtanim. Naglinis po ako ng surroundings namin na yung bagong tinira namin. So doon po nagsimula yung aking sugat. Una po nagtubig siya, parang may kumagat lang. May kumagat lang siya, tapos nagtubig. Habang nililinis ko po siya, dumadating po yung araw na pumuputok siya. Para siyang mga insektong maliliit na ano lang po siya, na pag tumusok, ano na po siya, makati. So doon na po nag-start. Nagbalat na siya, tapos habang nagbabalat siya, lumalaki, nabubulok yung sides ng mga sugat. So nakikita ko, sabi ko parang diabetic na yata ako. Wala nang pag-asang gumaling. So nagpatingin ako dun sa isang kaibigan ko na nurse. Sabi niya sa akin, pumasok ka na sa doktor, palinis muna. Sabi ko, ayoko. Kasi pag pumasok ako ng ospital, magbabayad na ako, baka sabihin putulin na yung pa ako. Kasi may itim na po yung gilid.
Mataas po talaga yung reading ng kanyang sugar. Hindi lang nakita sa ihi, nakita rin sa dugo. And yung pancreatic report niya, hindi na rin po maganda. Nung nakita ko po na nagtubig na yung sugat niya, and then nilalagnat po siya, yun ang kinakatakutan ko. Pag may lagnat ang isang tao na may open wounds, ang kalabang po yung sepsis na tinatawag, infection. Doon na po ako nag-start na hinihikayat ko siya kahit makarating man lang kami sa hospital para kung virus nga yung tumira sa kanya, malaman kung anong klase. Hindi ko siya kakupay inumin ng gamot kasi kahit paracetamol, namamaga po siya. May allergy siya. Kaya lang ayaw niya talaga. Ang lagi niyang sinasabi sa akin, pag ako dinala mo sa ospital, ikaw na rin ang pumatay sa akin.
Doon po ako natatakot. Ang sakit na nararamdaman ko po yung para siyang tinutusok na mapuputol na yung buto, yung buong pa ako, ganun po. Kaya halos kumapit ako sa yung ng bed, yung pinakabakal po sa bed. Di kumakapit po ako doon. Medyo namamaga-maga na nga po nung bandang huli. Laging nakatutok na lang po ako kay Lord na kung mapuputol, bilisan mo, wag mo akong pahirapan. Yun lang po sinasabi ko. Tsaka kung hindi mo siya puputulin, may purpose ka pa sa akin.
It's so painful. Pero sa sarili kong pamilya, parang failure po ako. Kasi ayaw nilang tumunod. Nung una, hindi ko pa siya ginamitan itong ImuRegen. So, sabi ko, wala naman mawawala kasi gusto mo na rin naman mamatay. Ayaw mo naman magpa-ospital. Actually, it was referred to me by a friend, a 68 years old man, about the beauty of the product. But on the first place, I was so hesitant. Sabi ko, ayaw ko, pare-pareho lang naman yan. Lahat na lang kako sa inyo maganda. So parang dalang-dala na kasi ako, parang wala na po akong pag-asa. After mga 10 days po, sabi ko, bakit parang hindi naman kako tumatalab? So sa maliwala po kayo't hindi, isang takip lang po ng ating liquid. Ang tingin ko sa liquid natin, para po bang may isip. Pagpatak ko dito sa point na nasa taas ng paa niya, imbes na dumiretso lang siyang ganyan, kitang-kita ko po na parang nag-spread siya, nag-circle siyang ganun, kinain niya po yung lahat. Na-distribute po siya. I don't know kung sa style lang po ng pagpatak ko yun o talagang yung liquid talaga ang nagtrabaho. And after na binigyan ko siya ng liquid, hindi ko na po nilinisan. Hindi na po ako naglanggas, hindi na ako nagugupit nung balat niya. Kasi pag hindi nagdugo, dinidibri ko po yun. Pag hindi siya nagdugo, bulok ang paa, wala po akong choice. Kailangan i-amputate yan. Sumisigaw siya on the first night kasi para daw may plastic na nakapulupot na ginaganon yung paa niya. And then ang napansin ko, yung lahat ng nana sabay-sabay na pumuputok. After I have put 5 ml of liquid doon sa kanyang open wounds, we could make money as our credit pero ang buhay, iisa lang po.
Alam niya po yon na mahal ko siya.
I have a story. My son was diagnosed last October of 2019 with something called complement deficiency or C2 deficiency. So I started working on learning about the system and really couldn't understand it until probably actually this last week when Dr. Oclarit was talking about it. But we started, so I started my family taking ImuRegen in June of this last year. And because there's been viruses around and everything, all three of us started taking ImuRegen once a day. And so I really wasn't noticing anything. And the only thing I could tell you right now is that Carter hasn't been sick, my son hasn't been sick where he used to be sick once every other week with sinus infections or some type of severe allergy attack or severe headaches due to sinuses. And that hasn't happened since March of this last year, which has been fantastic. But I haven't had his blood work tested, so I don't know if he's actually improved or anything like that. But what's kind of remarkable is that we've been learning about arthritis. And for the last 10 years, I've had arthritis in my knees. And I've had 2 surgeries. One knee really never recovered, so I usually walk with a limp. And I have a road that I walk on. And I used to be able to walk it, no problem. I used to, I did it every day. And then all of a sudden I had to start using walking sticks to walk the road. Matter of fact, my neighbors would make fun out of me because they asked me if I was going skiing because the pain was so intense, but I was determined to continue to walk. Well, in probably August, I started to notice that I wasn't using my walking sticks anymore. And I never put 2 and 2 together, but what's happening is that my knees are feeling so much better that I'm able to walk down the stairs with 2 different legs and alternating rather than 1 leg at a time. And I'm able to take walks on the road without walking, and I'm able to go on small hikes at this point. So I'm really thankful for ImuRegen. And there's been little other stories that have happened that have been fantastic too. So my husband's blood work came back and he's like, look at me, I'm so healthy. And not even kind of putting it together that maybe it's the product that's helping him have lower cholesterol and things like that. So that's my story.
Pina-CT scan po namin si Jores. Pagbalik po namin, yun nga daw sinabi ni Dr. Robles na severe autism po si Jores. May maintenance po siya. Pero yung maintenance, pag nawala po yung gamot sa katawan niya, nagiging mas lalo po siyang malakas. At saka pag binibigyan po siya ng pampatulog, hindi po siya natutulog. Nung lalabas siya dyan, ma'am, nakahubad. Tapos bigla lang niya itatapon yung katawan niya. Yung talagang naglalagabog. 15 years old siya, nung umpisa na po siyang nangungurot. Minsan nananampal. Nung 2015 po talaga, nung nag-maintenance na siya, doon po talaga yung worst. Kinakagat niya po ako sa kamay, hinihila niya po yung ulo ko, pati lahat po kami dito sa bahay, sinasaktan niya na kami.
Minsan pag lumabas kami ng bahay, lahat ng masalubong niya, sinasampal niya, sinusuntok niya.
Nag-ikot kami sa ukay-ukay. May isang babae na naganon siya ni Jores. Nagalit siya, sobra. Sinigawan niya si Jores, sabi niya ganon. Ano ka bang bata ka? Sabi niya ganon. Bakit ganyan ka? Lumapit po ako. Ma'am, sorry po. Kasi yung anak ko po, special child po siya. Tapos sabi niya, sinigawan niya ako. Wala akong pakialam kung special child yung anak mo. Dapat yan, nasa bahay lang. Kung kayo po ay nagiging isang ina, sabi ko sa kanya, at mayroon po kayong anak na katulad ng anak ko, maramdaman niyo po siguro kung ano po kasakit yung ginaganyan yung anak.
Bakit itong pangalawa meron na naman?
Si Cedric, lagi po akong umiiyak sa kanya. Dahil po, tinatanong niya po ako kung bakit po daw sila nagkaganon. Ayoko yung buhay na ganito. Gusto kong maging normal. Gusto kong mag-aral. Hindi ko pa pinapakita sa anak ko. Umiiyak po ako ng patagot. Pero nitong 2015 17 na nag-inom na siya ng ImuRegen, 3 nights namin na natulog siya diretso. So nakatulog din kami, parang abot langit na nakatulog ka, ma'am, ng diretso na umaga ka na nagising na Sabi ko, ano ba yun? Bakit ganun? Sabi ni papa niya, baka reaction ng food supplement. Kasi first time namin siya ginamitan ng food supplement eh. So wala nang tantrums that time. Sabi ng kapatid, mama, si kuya hindi na mainit yung ulo niya. Lagi na siyang nakangiti, tapos nagtatrabaho, nagwawalis-walis, nagliligpit na siya. Si Joris na sumisigaw ng wash. So napapahugas siya. Tapos tapos ko siya hugasan, sabi niya, thank you. Yung kaligayahan na yun, kahit sa ganun lang, ma'am, masaya ka, di ba?
Ang paghihirap ng isang parents na may anak na may autism, napakahirap. Alam ko na sobra din, naramdaman din ng ibang mga parents na may mga anak na ganito. Hindi tayo mag-give up. Ang mga bata, walang kasalanan eh.
I love you, kuya.
Last December 2017, parang naramdaman ko habang nagda-drive ako, parang sumakit dito na na side. Akala ko heart attack ako kasi na-heart attack.
A special lecture today with a special speaker who is part of our medical team, and I will be giving more details about his credentials. But the important thing is that we have a lot of attendees in our Zoom, so we welcome everyone, and there is a link there where you can click invite, copy the link, and then send it to as much people as possible while we are having our presentation today. Our speaker today is very special. First, he is part of our medical team with Dr. Mario Ramirez and yours truly, Dr. Arlie Perio of Forever Healthy LLC. Now, what is special with our speaker is that currently he is a professor in the College of Medicine here in the Philippines, in Asnar Memorial Medical Center in Cebu. And he teaches two very important subjects in the College of Medicine. No doctor can be a doctor if he takes these subjects. And specifically, he teaches physiology, which is the study of body function, and biochemistry, which is the chemical basis of our existence. Bio means life, chemistry means how all the interactions in the body would happen. Now, our speaker is a scientist and one of the best scientists, not only here in the Philippines, but in the world. He's been giving a lot of lectures in many countries. He had training in molecular biology, and I understand he has a PhD in molecular biology. And just recently, a few weeks ago, or specifically, I think it's by November or October last year, he was nominated as a nominee in the Nobel Prize in Chemistry. And so that's a very important, let's say, recognition. So today, our speaker is Dr. Jose Oclarit, PhD, and he will be discussing the molecular basis of cancer behavior and the role of ImuRegen. So, ladies and gentlemen, let us give a warm welcome to our speaker, Dr. Jose Oclarit, PhD.
Thank you for the introduction. Okay, may I use first the whiteboard in order? Yes. Okay, the topic that I'm going to tackle this afternoon is really very technical, molecular basis of cancer behavior. So we have to understand first what is a cancer and what is a tumor. Sometimes people are confused what is a tumor and what is a cancer. In your idea, tumor versus cancer. Tumor versus cancer. Do you have any idea of what is the difference between a tumor and a cancer, or are they the same in one basket? Related? Related ang idea mo. Kay Doctor, I think very clear sa kanya, no? Okay, let us really define it because sometimes people are confused. Oh, may tumor daw ako. Mabuti tumor lang. No, hindi pa siya cancer. So sometimes we downgrade tumor as not dangerous, and then we label cancer as dangerous. Sometimes we refer to this as a benign, while we refer to this as malignant. So A benign condition is a tumor, while a malignant condition is a cancer. Okay, so there are actually, in my study of cancer as a biochemist, I have defined, in my own definition, I have defined cancer in this way. What is the definition of cancer? Oh, what is the definition of a tumor? A tumor, the first definition of a tumor is a neoplasm. Neoplasm. What do you mean by neo? This is a new, the word neo is from the word new or bago. Plasma means cell. So when you say tumor, it is a new cell. It is a cell that you see that is not the same as the surrounding. So when you see something in your body, in your part of your body, and it does not look like the one it is supposed to be there, then you better subject that for biopsy because it might be a tumor, because it is a cell in a wrong place at a wrong time. So that is the first definition of a tumor. The second definition of tumor is it is a cell that has lost control. It is a cell that has lost control of cell division. Because normally, the normal cell has a normal cycle of cell division. They divide in a regular fashion, and it's like this. For example, the skin. The skin has several layers, and the basal layer is beneath is already in the stratum germinativum. The outer cells will die. So as a matter of fact, when we take a bath and then we kunin natin yung tawag nyo sa Tagalog yan, yung dead cells, yung libag, dead cells yan. That means it's already died, and therefore it ought to be replaced. And the replacement must happen in the stratum germinativum or in the basal layer. So the set of cells that has died must be replaced by the same number of cells beneath. Now, after they have already divided and reached the number of cells equal to the cells that died, they will stop dividing. That is the nature of the normal cells. They can detect it. They can detect it by because cell-to-cell contact. So by the time that they have already developed all the cells that are supposed to replace the old ones, they will stop dividing. But in the case of the tumor, they lost control of that. They keep dividing without control. That's why it will create bukol. Bakit? Sumubra na eh. Umiikot na eh. Hindi na siya mag-fit doon. Kaya they keep dividing without control. So what will happen? It will build up and pile up. And then it will create a mass. Muna magbukol siya kay wala naman, and it does not stop dividing. They keep increasing in number, layer after layer. Then the doctor will say, nag-hyperplasia. Hyper means many, plasia means cells. So many cells lining up, uncontrolled division. That's why it will create a mass. Kaya tawag yan tumor. So the third and final definition that I have defined in the term tumor, it is a cell that refuses to die. Cell that refuses to My last definition of a tumor is that it is a cell that refuses to die. Because under the normal circumstance, The cell, when they get old, they will undergo apoptosis. But the cancer cell does not undergo apoptosis. What is apoptosis? Apoptosis is the process of natural cell death, no? Which is opposite of necrosis. Kaya mayroon tayo we have a term, necrological service, meaning the person died. In our cells, once they die, they also undergo necrosis. That's where we get the word necrological. Okay. But if the cause of death is something like mechanical damage or disease, necrosis yan. Nalanta siya dahil lang kasakit. Because the person gets sick or they were undergo necrosis. That's why we have the term necrology for the person who died. But if the cause of death is natural death, that is not necrosis. Apoptosis. So ito tandaan niyo ha, mayroong difference. So sino yung namatay dyan? Namatay yan sa old age. Then that is not necrological. Apoptological service. No? Did you get the difference? The difference is, if you die a natural death, that is apoptosis. But if you die due to sickness, due to damage, due to poison, due to na-stab ka, that is necrosis. Did you get the difference? You die because something you have done that will destroy the cell of the body that caused the death. That is necrosis. But if you die a natural death, this is a programmed cell death, this is a natural system in your body, you call it apoptosis. The problem with tumor is that they refuse to die. They do not undergo natural death anymore. They keep dividing and grow and grow. That's why the doctor said, oh, we can, according to the microscopic analysis, there's nothing we can do because it is already on the terminal stage. Di ba, nag-staging ang doktor? Stage 1, 2, 3, 4. Stage 4. Stage 4, we say that, that is the final stage of the cancer, meaning the cancer, no matter what you do, maski sunugin mo pa, it refuses to die. Maski ni-radiation na, maski chemo na, hindi pa rin na mamatay, that is already stage 4. It is the cell that refuses to die. And I will explain to you later on, bakit siya hindi mamamatay. Why is it that the cell, so we will discuss the molecular basis of cancer behavior. It is very important. No? May joke ako before I proceed, may joke ako something here. Yung babaeng kasambahay, lumalaki ang tiyan niya. Sinaguri ang kanyang amo na babae niya. Hindi. Naguri ako sa iyo kasi bakit lumalaki ang tiyan mo? Pumunta tayo sa doktor, baka ipa-examine natin yan, baka cancer yan. Sabi naman ng kasambahay, oo nga ma'am, cancer ito. Nakuha niyo yung joke. Oo nga. And naguri ang amo na babae sa kanyang helper kasi lumalaki ang tiyan. Sabi niya, hindi, ipasamin natin yan, baka tumor yan or cancer. Sabi pa naman ng kasambahay, oo nga ma'am, cancer ito. Ngayon lang na nakuha. So yun ang joke doon. So ibig sabihin noon na pag sinabi mong tumor, may bukol. No? Ang ibig sabihin, may bukol. Normally, ang tumor may bahay. Mayroon siyang, tawag natin na collagenase case. Mayroon siyang case. Sa case sa Tagalog, mayroon siyang capsule. So nakabalot siya sa isang capsule, normally collagen. Rich in collagen. And I would like to tell you now that why do we have to refrain from eating cancer or from eating meat? Because it was found out in our study that majority of the components of collagen in tumor are coming from meat collagen. We can get collagen from plants, but the meat collagen is associated with tumor. So, yan, tandaan ninyo ha, you better refrain from eating too much meat because the collagen, which is the case, yung balot ng cancer or tumor, is actually collagen. Okay. Pag ang tumor ay nandyan sa, ito tandaan ninyo, ang skin cell, hindi mo pwedeng ilipat sa liver. Ang liver cell, hindi mo pwedeng ilipat sa lungs. Bawal yan, hindi yan pwede. Mamamatay yan kasi hindi sila magkapareho. The process of what called transplantation of tissues in the plastic surgery is that like to like cells. So that's why, as a matter of fact, if you are a surgeon, if something is wrong in your face, they will get the analog of this here sa puwet. Kung mayroon kang damage dito, we get it here or vice versa because in our body there are analogs. You can only transfer cells that are of similar in nature and similar characteristics in a place where they are similar. That's why dissimilar cells cannot be transferred to another area. Did you get it? That is the point of the definition of cell-to-cell transplantation, and therefore a tumor can also be defined as a cell that lost control of its growth in a different place. A tumor can grow in a different area. That's why sometimes the doctor will say, kung may bukol dyan, the doctor will say, oh, you better have a biopsy for that. What is the rationale behind the standard procedure for biopsy? Because the doctor wants to know where is the primary source of that bukol. Because it is possible that it is a breast cell. Mayroon akong pasyente na mayroon siyang breast cell 10 years back, and then after 15 years, mayroon na siyang tumor sa brain. So nag-order ang doktor na kailangan you need to have a biopsy. Biopsy is a necessary procedure for oncologists in order to find out the primary source of that tumor, of that bukol. Because it was found out that in that patient, yung cancer niya sa breast cancer, nagpa-chemo siya, nagpa-surgery, nagpa-radiation pa. However, some cancer cells of the breast have already migrated to the brain. And that is the reason why it needs to have a biopsy, because the doctor wants to know where is the primary source of that particular tumor. Why do the doctor have to know the primary source? Because each anti-cancer drug will only treat a certain type of tumor. So if it is a breast cancer, then you need to have a drug for the breast cancer cells. That's why there is a need for a biopsy. The migration of the tumor cells into the other area, or the ability of the tumor to migrate into the other area, which is not its original area, is actually a characteristic also of the neoplasm. No? Because it is new in a wrong place. No? That's why if you observe something in your body that is not the same, bakit yan mukhang very reddish na smooth na pag-biopsy mo yan. Kasi baka tumor yan. It is a cell in a wrong place. That is the meaning of tumor. Okay. Now, what is the difference between a tumor and a cancer? Katong cancer nga cancer, no? Cancer ng tubo, matibaya, di ba? Lumalaki din kay cancer. So, tumor. Okay. A cancer is a cell that has lost also, that has the ability to migrate. And they can digest the collagen because the cancer cells in a cell there, they produce what we call collagenase collagenase, and this collagenase will be used to digest the wall of the tumor. So a tumor is also a cancer. A tumor is also a cancer in a shell. That is how to differentiate a tumor. So kung tumor and cancer, they are this one and the same in the same coin. The only difference is that this one has a case and the other one has already overcome the case because they will destroy it and they start invading. First, they invade the collagenase, and then they go to the blood vessels. And then once they invade, across the border, they will produce what you call angiogenic compound. They will try to communicate to the blood vessels to produce a new line of blood vessel in order to supply nutrients for the growing tumor. Kaya hindi mamamatay yan pag walang dugo. So ang gagamitin lang, what they will do is that they are going to release the factor for the growth of new blood vessels. You call it angiogenesis. Angiogenesis. The word angio is a small vessel. Angio is a small blood vessel that when it's already reduced by collagenase, they will now connect to the blood vessel to release the factor for the cell to produce new line of blood vessel, parang bagong tubo, para kumuha ng dugo from the source supply so that the tumor will be able to have nutrients. That is why one of the approaches to control tumor is to destroy the vessel, yung tumubo na blood vessel. Patayin mo yan. The cells in the cancer, they will die because there is no more supply of blood. That's why a pregnant woman also cannot be given an anti-angiogenic compound because the fetus is also complied with lots of new blood vessels. So that is how. Now, in the study of ImuRegen, we found out that ImuRegen has the capability to destroy the angiogenic compound and prevent the formation of angiogenesis so that the tumor will die because there is no more supply of blood. That is the reason behind it. So that's how effective our ImuRegen is. Because according to the literature that I read, our ImuRegen bottle contains a factor that will now inhibit the angiogenesis. So I repeat, the tumor and cancer are all one and the same. They are new cells in a wrong place. They have lost control of cell division because the normal cycle of cell division is today there are cells that grow and there are also cells that die. As a matter of fact, according to the study, 30% daw sa dust in our house are the dead cells coming from our skin. Kasi pag natulog tayo, yung kumot natin mag-grab doon sa ating skin, kumagahan, may mga cells na nagsished off. There are cells that sheds off during the night. And then, ipagpagni mo yung kumot mo at sa kaunan, nagiging dust. So, 30% na ng dust sa bahay natin ay nanggaling sa ating katawan. Yung pag ganyan nag-dust sa bahay, lalo doon sa mga window, mga patay na cells yan galing sa katawan mo. Oo. Pagligo natin, marami ding patay din. Kasi, on a daily basis, there are 90 billion cells that keeps dividing to replace the old ones. 90 billion cells, ha? nga yung nag-shoot off, namamatay, ganyan, by apoptosis yun. That is natural. So everyday apoptosis, everyday cell division, and there are two types of cell division. Sino ang naka-remember sa inyong general science? There are two types of cell divisions. Sino naka-remember? Binary. Hindi yan binary. Binary bacteria yan. Basta binary cell division is bacteria. Tao tayo eh. We have two types of cell division, mitosis and meiosis. Naka-remember na? Naka-gets na? Mitosis and meiosis.
Absent si Dr. Absent si Dr. Arnie, may emergency.
Ang meiosis is what we call reduction division. So ang word mitosis is in the all throughout the body. All is soma in the somatic cells, no? Madaling magiging anemic ang iyong mga ano dito.
Kulang sa nucleotides. Kulang na blood.
So ang mitosis is the cell division sa body. Walang laman. Mitosis is a cell division that occurs throughout the body except the ovary and testis. Pag nag-divide kasi ang cell, before mag-divide ang cell, so if this is our cell, original cell, it is called 2N or diploid. Bakit 2N? One set from the father, one set from the mother. Before the cell divide into mitosis, it will now duplicate in the process called replication. Wala good. Walang laman. Before the cell divide, remember this, before the cell divide, the chromosome, the complete set of chromosome, how many chromosomes is our complete chromosome? 46. So before the cell divide, the number of cells must be doubled. So how many before the cell divide? Before the cell divide, 46. Walang laman pa rin. Before the cell divide, 46. So before they separate into two daughter cells, nakakainis man ito eh. Nakakainis itong ano mo. So nagiging ilang?
So palit ang whiteboard.
Nagiging 92. That is why every day we need nucleotides. Why? Imagine ka na 90 billion cells will die in a daily basis. Tapos, it must be replaced also. Apoptotic cells will die today. There are also the cells that have to be replaced today. So, you require nucleotides. That's why we have to take nucleotides every day in order for this equilibrium or in order for this homeostasis of cell division will occur. Because remember, the 46 chromosomes of our body must be doubled into 92 before the cell divide, because one set will come here, in one daughter cell and another in another daughter cell. That is 46, no? So this is what this is called mitosis, no? So mitosis, the purpose of mitosis is to maintain the number of chromosomes in all the cells of our body. I would like to tell you, all the cells of our body from top to our toes, all the cells have equal number of chromosomes. And it must, so during replacement of cell division, this must be maintained at all times by providing nucleotides at all times. So this is one aspect also of cancer theory to really maintain the level of nucleotides in our body, because once the nucleotides are of the low level, our body will undergo what you call genetic instability, and genetic instability is the number one cause of cancer. So the number one cause of cancer. Okay, before I proceed further, so that is why I am a biochemist and a molecular biologist, and I have studied cancer in my PhD in Japan and the United States. And we have concluded that if you are going to ask me whether or not I will approve of the procedure of, although it is necessary, but whether biopsy is a good recommendation or not. Do you know the reason why I will not? Because most biopsy is done by fine needle biopsy. Maliit na needle. Tusukin nila itong tumor, asa suyupin na nila yung cells dito sa loob para tingnan nila sa microscope. So suyupin nila para lumabas yung cell sa fine needle biopsy. By doing biopsy, you're actually physically making a way for the escape of the tumor, making another tumor, secondary tumor. That's why most women nga, Dok, katulaging before ko nag-biopsy, Dok, isa naman to kabukol. And then after the biopsy, nagiging 4, nagiging 5. Sa mother-in-law ko, isa lang tumor dito. After biopsy, nagiging 4 na. Isa lang tumor dito. After 2 weeks after biopsy, 3 or 4 na ang kanyang tumor. So that is the reason. So biopsy, bagamat ito ay is a logical procedure, I still disagree on it because it paves the way for the physical exit of the abnormal cells to form into secondary tumor on the surrounding area. Did you get the idea? That's why biopsy is not advisable. If you really suspect that is a tumor or cancer, then patanggal mo na all the way. Then saka tanggal na diretsyo na analysis kung cancer ba o hindi. Like tanggal bukol ito. Tapos gusto mo nang kunin kasi very disturbing at saka painful. Okay, if you want, I will approve of the surgery, then direct na analysis. Hindi na patagalan kasi kung tagalan mo, like mag-biopsy ka ngayon, then later on, mag-wait ka pa ng 4 months para mag-decide ka pa o magpa-opera ka o hindi, or mag-chemo ka o hindi. Now, you have already given the way for the tumor to form a secondary tumor. So you better decide whether to excise it, and immediately analyze whether it is a cancer or tumor. So what is the difference between tumor and cancer? One, it is called benign because it is confined on a shell, while a cancer is still a tumor, but it has already the ability to invade. You call this metastasis. So a cancer is a tumor that has the ability to metastasize, while a tumor is still a cancer but within the boundary of the collagen. Mayroon siyang bahay. So between the two, benign ang tawag dito kasi pwedeng niyang surgery kaagad, i-isolate at mawawala na kaagad. Kasi anyway, isolated man siya. So kung tumor, madali siyang i-control by excision. Pero kung malignant na, that's why this one is a benign tumor, this one is a malignant tumor. So the tumor and cancer are used interchangeably in terms of their physical, biochemical, physiological characteristics. So magkapareho lang yan. Ang isa, mayroon siyang sariling bahay, tumor yun. Pag ang tumor ay hindi na siya, napakawala na siya, nagiging metastatic and ability to invade the other areas of the body, yun ang tawag natin malignant or cancer already. Ang staging kasi ganyan, stage 1, pag ang mga tumor ay nasa paligid, paligid lang niya sa nearby areas, stage 1 yan. Pag nandun na sa organs, medyo malayo, stage 2 na. Pag nasa farther away, mga 3 magnitudes away from the source, stage 3. Pag stage 4 na, all over the body na yon. Systemic ang tawag. So staging sa cancer, stage 1, stage 2, stage 3, and stage 4. So a stage 4 cancer is a cancer cell that refuses to die. Okay, so we will proceed to the slides. I will now go to the prepared slides that I have. We are now ready to digest what we have. So a cancer, so you have now a basic idea between a cancer and a tumor, no? So you better, and I would like to tell you along the way how ImuRegen could really help in controlling the cancer behavior. So the molecular basis of cancer behavior. Next slide. If we understand fully what really a cancer is all about, it is, okay. About 1 in 6 of us will die of cancer. So mag-random tayo. 1, 2, 3, 4, 5, 6, patay. 1, 2, 3, 4, 6. So 1 in 6 of us will die of cancer. Cancer is still the leading cause of death in the whole world. No? About 1 in 6 of us will die of cancer. And what is the definition of cancer? In my definition of cancer, I define it in 3 ways. It is a new cell in a wrong place. It is a cell that lost control of cell division, and it is a cell that refuses to die. In the definition given by the book, the cancer is a cell that breaks the most basic rules of cell behavior in which multicellular organisms are built and maintained. So what is the normal in the multicellular cells? We are a multicellular individual. Our muscles are different from the bones. The bones are different from the nerves. The nerves are different from the skin. The skin are different from the cartilage, and so on and so forth. So each of the cell, bagamat all cells are uniform in terms of genetic makeup, they have different genetic expression. Yun ang sabi doon. That is why epigenetic factor is the one controlling the differentiation. Sa loob ng nanay natin, nung nagtubo pa tayo doon, ang cells uniform. But later on, it differentiates into different organ, nagiging liver, nagiging stomach, nagiging intestine. And they have differentiated into the different forms of cells in the body. And they are built and maintained by regular cell division, mitotic division. So mitotic division assures that each cell, when they divide, when one cell becomes 2, the 2 daughter cells will have equal amount of genetic materials or the same number of chromosomes all the way. Ang meiosis, on the other hand, meiosis only happens in the testis of the male and ovary in the female. What happens in meiosis? During the first meiotic division, the 46 chromosome will now be reduced to 23. So when they divide, only 23 goes. One set goes to the one cell, another set goes to another cell. That is what you call reduction division. The second meiotic division is known as equational division. Nagiging 4 sila, pero yung pangalawang division, equational na 23 will be duplicated to 23. Whereas in the first meiotic, so the meiotic division is divided into two divisions, meiosis 1 and meiosis 2. In meiosis 1, reduction division. In meiosis 2, equational division. Dinudoble na lang yung kanilang cells, number of chromosomes. What is the purpose? The God in heaven who designed our body is really wonderful. Bakit kailangan niya pang i-reduce? Dahil during gametogenesis, kailangan 23 chromosomes lang talaga ang laman. 23 chromosomes lang talaga ang laman sa sperm cell. In the ovary also, the egg of the woman must have also 23 sets of chromosomes only as a byproduct of cell division in meiosis. Why? 23 is just 1/2 of the total. Because during the union of the male and the female gametes, the egg and the sperm cell and the egg cell is known as gametes. Di ba? Last night, gametes. The egg and the sperm gametes, when they unite, they will now complete the 46 chromosome. 23 plus 23 equals, kaya 1/2 plus 1/2 equals 1. That's why in marriage, and the man cleave to his wife, and the two becomes 1. Why? 1/2 plus 1/2 equals 1. So mayroon yang reason na kung bakit they are one in matrimony. So that is the spiritual implication also, and the physical basis and the molecular basis can be viewed from gametogenesis and meiosis. 1/2 plus 1/2 equals 1. So meiosis is really very, very important. So meiosis only occurs in the egg, in the ovary of the woman, and in the testes of the man. But all throughout the body is mitosis. And that is the basis for the normal basic rules of cell division. The basic rules of cell division is this. The normal cell will, if they die according to schedule. So, for example, in our skin, every 28 days, namamatay yung cell. So, another set of cell will be replaced in. So, today, there are set of cells that die today. So, today also, those cells that die must be replaced in the basal lamina, must be replaced by the same number of cells. So, for example, naubos yung 1,000 cells, underneath your skin, there must be new 1,000 cells. Now, the body detects that if the cell, when they divide, they keep dividing. When they reach the number of cells by cell-to-cell contact through their desmosomes, they will now signal to stop the cell division. But in the case of cancer, they don't stop the division. So they lost control of the cell division at tawag doon. Maski narating na yung 1,000 cells, they still keep dividing. That means that particular cell becomes cancerous already. And one of the important enzymes that was found out in the cells that are dividing, even if it is after normal, when they produce the enzyme called So it was found out that a cell that has lost control of cell division has a elevated level of telomerase. So in the United States today, one of the cancer assay para mahibawaan mo na cancerous na siya is through telomerase enzyme activity. Kuhaan kag dugo, tanaw ng telomerase, kung taas ang telomerase, kunya na ay bukol diha, then that means that bukol is already cancerous. You don't need a biopsy anymore. So this is a radical procedure that they have done in America. So makuha lang sila ng, instead na i-biopsy nila, kukuha lang sila ng fluid dyan, area na yan, sa dugo, tapos titingnan kung tumaas yung telomerase. Pag tumaas yung telomerase, ang ibig sabihin, cancerous na siya. Because a cancer cell has an elevated level of telomerase because Telomerase is an enzyme that will help the cell divide and divide and divide and divide. So cancer cell, by definition, saan bang cover nito? Cover. Okay. So, intindihan niyo yan? The cancer breaks the most basic rules of cell division by which multiple organisms are built and are maintained. So, here is a diagram. Ang pinakamataas daw na rate sa cancer is, by the way, dito sa diagram na to, ang pinakamataas na rate sa cancer is reproductive tract, no? Sa uterus. This is referring to the uterus in the women, no? So cancer of the uterus, followed by the cancer sa colon, followed by the cancer sa breast, followed by the cancer sa lungs, and then followed by the cancer sa blood, and then urinary system, and then down the line. So ganyan. Now, sa categorization sa cancer, there are four categories of cancer types. Ang isa is carcinoma. Carcinoma is the cancer of the epithelial cells. Do you know the meaning of epithelial cells? Epithelium is the lining of the organ. And the lining of the organ keeps on dividing to replace the old cells. So that is the meaning of epithelial cells. So all the epithelial cells of the body, during the cell division, I would like to tell you, during cell division, the chromosome becomes naked. Because right now, as you sit down, the cell inside the chromosome or the DNA inside our cell is intertwined with proteins. Nakabalot siya. That's why hindi natin nakukuha yung nucleotide sa kain lang ng karne. Dahil nagmamadali tayo, di ba? Pag usually kahit 2 kit-kit lang, swallow ka agad, di ba? Kailangan dapat i-digest mo, yain mo yan ng 32 times kasi para makuha mo yung nucleotides. Paano natin makuha? 2 nguya lang na, kinain natin. Now, ito tandaan ito. Why? Why did I emphasize ang tawag ito? Why is it that 90% category sa cancer, ha? The kinds of cancer or categories of cancer, kinds. One is carcinoma. 90% of cancer is the cancer of the epithelial cells. Epithelial cells. Epithelial cells, why is it that epithelial cells is prone for cancer? Epithelial cells is prone for cancer because epithelial cells are rapidly dividing. Mabilis silang mag-divide kasi sila yung nagre-replace ng mga old cells. During cell division, the chromosomes are naked. That means sila lang, wala silang kapartner na mga mga proteina. So because the chromosomes are naked, they are subjected for radiation sa araw, and they are easily subjected to chemical mutagens in our food, the environment, the food that we eat, the drinks that we take in will be providing us mutagens, food coloring, mga chicheria, etc., mga food preservatives are highly mutagenic, and so during cell division they are open. That's why they are subjected to mutation. Mutation is always the underlying. The number one reason for cancer is due to change in nucleotides or mutation. So 90% dayag na lang de modo. Why is it that 90% of the cancer is carcinoma? Because epithelial cells are naked. Huh? That is the meaning there. The second type of cancer is called sarcoma. Sarcoma is the cancer of the connective tissues. What are the connective tissues of our body? We have the muscles and bones. And then the third type of cancer is called lymphoma. This is a cancer of the, example to this are the Burkitt lymphoma, the cancer of the fat cells, the fat and the nerves. And then the fourth type of cancer is the leukemia. Grabe ka talaga ang ano niyo, hindi na sumusulat. Wala na talaga ang laman. Walang laman. Wala nga eh. So ilang klase? So, 4, carcinoma, sarcoma, lymphoma, and leukemia, cancer of the blood, no? Yung tawag natin yung cancer of the white blood cells, like leukemia, that is a form of cancer, no? Cancer of the blood. So these are, the rest of the, so 90% is carcinoma, the rest are distributed between sarcoma, lymphoma, and leukemia. Okay. So dito sa reproductive tract, ito epithelium reproductive tract is epithelium. That's why it is called the cancer of the reproductive tract. Okay, so look at the normal course of. So look at the one I have illustrated earlier. A tumor, this is the normal in the duct or in the lumen, for example. The lining of cells there. You have the basal. The benign tumor are those cancer cells that are in a shell. Meron silang basal lamina, may bahay. Tapos yung malignant tumor or cancer, na lumalabas na sila. Di ba yun sa illustration ko kanina? So this is a tumor, yung dalawang tumor pa yan, yung isa cancer na. Kaya ang cancer is known also as malignant tumor, while a benign tumor is just the tumor itself. No? So those are the definitions of illustrations. Ayaw na niya. No. Okay. Pag nagpunta ka sa doktor, pag nakapa niya na mayroong palpable, anong ibig sabihin ng palpable? Pag kinapa mo, mayroon ng bukol na nakikita mo. Ang ibig sabihin noon, pag may bukol na, ang number of cells niyan equivalent to what is 10 to the 9? What is 10 to the 9? That is billion cells. That means late ka na ng 5 years. So ibig sabihin pag kinakapa mo at saka may bukol, palpable na yan. Tumor first is palpable in 10 to the 9 cells, what is 1 billion cells. Pag dumating na yan sa 10 to the 12 cells, patay na yung pasyente. That means na siya, systemic na talaga. Systemic. Pero pag ang tumor na-detect sa X-ray, pag na-detect siya sa X-ray, 10 to the 8 pa yan. Pag na X-ray plus na-detect sa palpation galing kinakapa. So pag kinakapa na 10 to the 9. Pag kinakapa tapos wala, pero nakikita sa X-ray, 10 to the 8 lang yan. Pero pag na 10 to the 12 na, patay na yung pasyente. Okay? These are what we call the tumor population doubling in a linear fashion. So this is one example of a mutation. So between chromosome 9 and chromosome 22, we have 23 pairs of chromosomes because we have 46, no? 46 is divided, are grouped into 23 pairs. chromosome 9 and chromosome 22, minsan mayroong spontaneous na puputol yung part ng chromosome 9 tapos part ng chromosome 22 na exchange or kaya nagdugtong doon. So yung part ng chromosome 22 na nadugtong doon sa chromosome 9, kaya nagiging itong chromosome 22 na naputol siya 22q minus q kani. The meaning of q is that there are in the letters of the alphabet, ano ang letter na magkasunod? PQ. The letter P represents for petit. Maliit. So this is the P arm. Sa chromosome kasi mayroong long arm, short arm at saka may long arm. So this is the P, this is the Q. So ang chromosome 22 naputol sa Q arm. Kasi ito yung P arm of the chromosome. This is what is the next letter to P is Q. So the Q arm of chromosome 22 was cut and then it was added to chromosome 9. So chromosome 9, pag naputol, kasi pag naputol ang chromosome, pwedeng idagdag doon sa kabilang chromosome. So this is a typical example of mutation. So ito, nakikita nila yung mga sa X-ray or sa microscope, ito ngayon ang neoplasm. So itong mga yung markahan nila, yun ang mga active cancer cells. So ang kita dito sa diagram na to, in this diagram, cancer begins after the age of 40. There is no cancer due to one single cell. A cancer is due to multiple mutations. So yung pinanganak pa tayo, wala pa masyadong damage kasi hindi pa masyadong nakikita sa araw, wala pa masyadong stress. Multiple mutation accumulates at the age of 40. So after the age of 40, there will not be an increased incidence of cancer. So ito yung normal pathway sa cancer. So cancer begins normally at life begins at 40. So mag-ingat tayo dyan. Ha? So cancer begins in this case, nakita mo yung pagtaas ng cancer starting at the age of 40. So mag-ingat na tayo. Nandito na ako. So marami na akong So ako, vulnerable na ako for multiple cancer, no? Nandito ako eh. So pag nandito ka na, dito na ikaw, ilang cancer na kaya cells? I would like to tell you now, in my lecture this afternoon, little did you know that akala mo wala kang cancer, lahat tayo may cancer genes na pala. Mayroon na tayong cancer genes that we have acquired from our environment. Sinabi mo lang na wala kang cancer kasi hindi pa siya na-detect. Di ba pag kinakapa, wala pa 10 to the 8. Pag nakapa na, 10 to the 9. Pag namatay na, 10 to the 12. Patayan nyo yan, ha? So, exposure after years of exposure to chemical substances. So, kung less than 2 years, okay lang incidence of, this is on the cancer of the bladder, exposure to environmental factors. So, less than 2 years exposure, 3 to 4 years of exposure, more than 5 years of exposure. So, exposure to constant mutagenic environment can cause rise in a cancer incidence. So, ganito yung sinasabi natin. Paano nalaman na pala siya malignant na o kaya ito, tingnan mo, pag normal, ganito itsura. This is the epithelium. Diba? Ang epithelium is the lining. So, this keeps on dividing. And then, this is the low-grade epithelial, intraepithelial neoplasia. Mayroon na siyang bagong neo kasi mayroon ng bagong cell. Pero hindi pa siya gaano. And then, this is a high-grade intraepithelial neoplasm. And this is now the invasive carcinoma. Bakit ba itim ang cancer pag nakita sa microscope? Kasi ang cancer is fast dividing. And the chromosome will divide and divide and divide. There is a lot number of chromosomes. Yun ang nagiging yung gene sa ang itim nito, ibig sabihin these are all DNA material. Ibig sabihin, there are so many chromosomes already. Kaya invasive na ito. Pag nakita sa microscope, pag nakakita ka ng ganitong itsura, that means kung masyado nang maitim, that is now an invasive carcinoma. So, the same is true. This is a cancer of the blood. So, ito, normal. Then ito yung in between. This is now invasive. Ano naman siya? When we talk about cancer, we deal with two major factors. One is what we call oncogenes, and the other is a tumor suppressor gene. So now, if we are normal, you see that we don't have cancer, but we have two sets of genes in our body. One set of genes is called oncogene. We have already the oncogene, proto-oncogene in our body. Tumor suppressor genes, where mutations and epigenetic changes are expected. So, mutations and epigenetic changes will be affecting either of the oncogene or of the tumor suppressor gene. So, in essence, the tumor or a cancer, when you talk about cancer, we talk about two factors, oncogenic factor and tumor suppressor genes. From the word tumor suppressor gene, it means that in our body, there are natural substances that can kill the tumor. Tawag on, that can suppress the tumor. That is why our ImuRegen bottle contains tumor suppressor factors. Kasi all the contents of our ImuRegen are taken carefully from the organs of the cells of the body that were carefully extracted to get all those factors. That's why, di ba, ang kita doon sa experiment, may tumor cells, tapos pinakain ng ImuRegen, yung tumor namatay. Yung hindi tumor, pinakain ng ImuRegen, tumaba at lumalaki.
Dr. Plus, okay lang.
Yes. Lahat ng either immune plus, liquid, or glucan. Okay? I repeat, in our body, there are two factors already that is present. To undergo rapid cell division, that is actually representing the proto-oncogene. So lahat mayroon tayong proto-oncogenic factors that will help our body divide the cells. So the proto-oncogenes are factors that will help our body divide the cell. But in a normal cell, this proto-oncogene is controlled by what you call the controlling mechanism, intrinsic control mechanism for cell division to control. Because once, as I've said, once the cell will have attain a set of cells, cell-to-cell contact, they will stop dividing. So there are self-inhibitory in a particular case. So mayroon tayong proto-oncogene. Kasi kung wala tayong proto-oncogene, if we don't have the proto-oncogene in our body, then our cells will have no ability to divide. So which means to say that we have our own natural proto-oncogene. On the other side, we have also the tumor necrotic factor, that in case our body will have abnormal cells because of mutation, there is a factor in our body that will now suppress the tumor. You call it the tumor suppressor gene. So either oncogenes or tumor suppressor genes where mutations and epigenetic changes are expected. That's why our ImuRegen bottle is always, I emphasize that one of the most important positioning of our ImuRegen product, it is an epigenetic medicine, because ImuRegen can change the course direction. If there is abnormality in your cell, then ImuRegen will now direct your cell to become normal using those corrective factors that are found in the 118 oligopeptides. Kita mo? Did you get the idea? So oncogenes and tumor suppressor genes are according to, in essence, they are two sides of the same coin. Oncogene and tumor suppressor gene. They are two coins there are two sides of the coin in one coin. No? The same kinds of effects on cell behavior can result from mutations in either class of genes, either proto-oncogene or tumor suppressor gene, are affected by the behavior of that cell are affected and controlled by the central dogma of every cell of our body. And the most cellular control mechanisms have both stimulatory means that is to stimulate the cell to divide, that is proto-oncogene, and inhibitory factor. When there is an abnormal cell, our body has the ability to suppress. That's why it's called tumor suppressor component. So our God in heaven have created our body so that when we encounter abnormal cells every day, there is already an intrinsic factor in us that would allow our body to heal itself. And plus the fact that we are taking now the ImuRegen. ImuRegen is really a complete concoction that will provide us the epigenetic factors that will now help us operate what you call the inhibitory factors. The inhibitory factor in our body is the tumor suppressor components. So did you get that idea? That our body has two factors already. We have both the proto-oncogene for the cell proliferation, and we have the tumor suppressor gene. In case there are abnormal cells, our body will have the ability to detect it, and our body will now produce those factors that will suppress and one of that is the P53. So one of that is the P53. The P53 is very versatile. When the P53, when our body will, because we are subjected to sunlight every day, diba? We are subjected to mutations every day because of the environmental factors we are in Manila. There are so many pollutions. Pagkain natin dito, they are all contaminated. When our body detects that there is abnormality, the P53 will immediately appear in order to stop the error. The body has the murag break ba. The P53 is a protein. The word P there, the letter P there stands for protein. 53 stands for the size of the molecule, which is 53 kilodalton. So a Dalton unit is 1 kilodalton. That means P53 is 53,000 daltons. That is the size of the molecule. That will now, the pinaka-highlight ng P53 is that P53 is a protein that will appear in our cell if our body detects that there is abnormal cell. If there is mutation that occurs today in your body, your cell will produce P53. And if you don't have P53, you really have to take your ImuRegen because ImuRegen contains P53. So, yun ang pinakamaganda sa dyan. So, sama niya siya. Kung minsan umaandar, kung minsan hindi. Isa, weak ang battery siguro. If the aim is to understand how cancer cells functions, the most important distinction between the two factors is that the oncogenes and suppressors, but between the cancer, the critical genes that act in different biochemical pathways. So between the two factors, the proto-oncogene and the suppressor, but between the cancer and the critical genes that act in their different biochemical pathways, you have to examine. So some of the pathways to consider in cancers. What are the signals from the environment? Signals gani means the chemical substance coming from the environment. It may be smoke, it may be chemical substance, asbestos, or whatever. The cell's internal programs. The cell's internal program is within our blueprint already. And the control of cell cycle, proliferation, the program cell death, the cell's movement, and the mechanical interactions with its neighbor and cell additions. Remember that cell-to-cell contact will only be strengthened if they are in the same cell. Liver to liver, skin to skin, those are what you call skin to skin or cell-to-cell contact, recognizing what you call the connexons. The connexons are proteins in between the cells. And each type of tissue have different connections. So ibang connection sa liver, iba ang connection sa stomach, and so on and so forth. So these are the pathways to consider, no, in understanding cancer. Some manifestations of misbehavior of cancer by the cancer cells. So what are these misbehavior of the cancer cells? So the molecular basis of the misbehavior: uncontrolled growth, and then there is an increase in cell division. That means hyperactivating the proto-oncogene, decrease the cell death, so wala silang apoptosis, di ba? They refuse to die. And then you have decrease cell death, aberrant characteristics like proteins that has mutated, involved in DNA repair, the cell signaling pathway, the cell cycle, cell growth, the program, cell death, and tissue architecture. By the way, hindi na ba talaga ito hindi na. Sa cell cycle. Cell cycle. Review tayo sa cell cycle, ha? Sa general science ninyo. There are two phases of the cell cycle. You have the M phase and you have the S phase. S phase. In between is what you call the gap 1 and we have the gap 2. So this is the cell cycle. So there are two phases of the cell division cycle. You have the S phase. S stands for synthesis. Synthesis of what? Synthesis of DNA. So it is during the S phase where the DNA is doubled or the chromosome is doubled in preparation for the cell division, because one single cell will become two daughter cells during the M phase. So you will notice that before they go to undergo the M phase, the DNA must be duplicated during S phase. So pag natamaan ka ng araw dito sa S phase, nasira yung DNA. If the DNA is damaged, then P53 will appear. What is now the role of P53? The DNA must be repaired first before they proceed to division. So before they are going to complete the replication of the DNA, P53 will allow the repair in order to restore the DNA to normal before they will divide into two daughter cells, so that it will prevent tumor. However, cancer cells have manifested misbehavior. They lost ability to the DNA repair. They lost ability. Their cell signaling system is destroyed. The cell cycle is altered, and cell growth and the programming of cells, cell death, and tissue architecture is also destroyed. So that these are actually the things that happen for the cancer cells. Forward mo lang, di man siya yung battery mo masyadong wala na. Okay. So here are some of the genes that were discovered in our body. The first one here is that we have the RB gene. RB gene originally cloned, which was mutated from retinoblastoma. The initial RB were actually taken from retinoblastoma. So may mga retinoblastoma cells that grows in a human body are coming from RB gene. There is also an RB gene in our body that was discovered to be RAS gene. RAS gene is a central component of the RAS gene is a central component of the intracellular signaling pathway. So it is already in our body. Mayroon na tayong RAS gene. Because RAS gene is involved in signaling system. The signaling system includes the hormone to hormone action, the hormone signal to the target. Those are what we call cell signaling system, and the RAS gene is involved in there. The RAS gene is present in our body already. Another one is the WEN gene. The WEN gene is a hedgehog gene. This is a signaling pathway that involves to transmit information to embryonic cells required for proper development. So for the proper development of the baby, there must be the involvement of the WEN gene. But once this WEN gene will go on what we call abnormal pathway, then it becomes a cancer gene. There is also the tumor growth factor beta. There is the NUTS gene. In humans, there are 4 genes. NUTS 1 to 4. It is a single pass transmembrane receptor that promotes proliferative signaling during neurogenesis, neurogenic development of brain. And its activity is inhibited by NAM gene to promote neural differentiation. So we have NUTS genes, we have NAM genes that will be involved in the neuronal development as well as in the control of the differentiation of the gene expression. We have also the epidermal growth factor receptor gene, a tyrosine kinase signaling pathways. So all these are genes that are already found in our human body. So little did you know, ayaw mag-ingon nga wala may cancer na atatanan. All of us have cancer factors. The one that I am mentioning here are all the existing human genes, some of which have the functions. Unsay function gani sa NUTS gene? Unsay function sa NUTS gene? The function of promotes proliferative signaling during neurogenesis. Imagine, that gene is involved in the normal development of the brain. Pero if that will now be destroyed by misbehavior, then it becomes a tumor of the brain. So that's gene. The NAM genes are also genes that will promote the neural differentiation, because in our body there are glial cells, astrocytes, there are dendrocytes, there are Schwann cells, there are nourishing cells. So they differentiate into different types. That is due to the NAM genes. If the NAM gene will not function, then it will undergo a tumor of the brain. Then we have also the epithelial growth factor, epidermal growth factor receptor, which are involved in signaling pathways of our cells in the skin and all parts of the body and many organs of the body. Epidermal gani skin, no? Epidermal skin. So these are the factors that are present in our gene that are considered to be what you call cancer factor. There is also MYC gene and the RAS genes. Deletions of tumor suppressor gene. So pag nawala yung tumor suppressor gene mo, often if the tumor suppressor gene in our body is deleted, then it will lead us to death. Mamatay tayo kung wala tayong tumor suppressor gene. It leads to death at embryonic stage, reflecting the essential role of this gene. So the tumor suppressor gene is very essential in the normal development of our system. So remember this, that all of us have all these genes that have the propensity to be either cancer or tumor, either especially if there is a deletion, mutations in the genes. So here is the age in days. So this is age up to 200 days. Age in days, they found out that the MYC and the RAS gene will actually, the tumor-free mice, no? Yung kanyang ability to control the cancer in number of days. Ang MYC is faster compared to RAS. Ang MYC plus RAS, ang mabilis mag-recover. Then ang RAS followed by then MYC. Pinaka-potent talaga ang MYC. So many cancer critical genes regulate proliferation. So I repeat, many cancer critical genes regulate cell proliferation. Mo na siya. Look at this. Tanawa. This is now the regulation of our cell, no? Adiri MYC gene, ang MYC gene, nadiri ang TCF, nadiri at tanawa ang P53. The P53 is actually involved in cell proliferation because P53, once there is a damage of the DNA, there is a DNA sensor that will now allow the production of P53, and then P21 is also another factor that will protect the cell from further cell death. No? So here are some factors. So either growth factors acting into our epithelia, our membrane, no? There are tyrosine receptor kinase, the hormones, the production, yung pagkain, growth factors, and so on and so forth. Look at the growth factors o pathway. Taghan, RAS gene, you have the RAF gene, MYC gene. Meron pa, you have the cytokines. In the cytokine storm, this is the pathway for the signaling system of cytokine storm. It causes changes in the gene expression, cytokine, sa mga immune system development. So this particular diagram shows to us that our body is so complex that the environmental factors affects us, and if there is something wrong with this pathway, then it will develop a cancer cell. So what did we say that the cancer cell? Because they lost the ability to control cell division, they keep dividing, and they refuse to die. A well-studied example is the tumor growth factor signaling pathways. Loss of function mutations in the pathway contribute to development of several types of human cancers. So, pag nawala yung function ng TGF-beta, pag nawala yung function, naman na yan dahil magkaroon ng human cancer. So, the function of those genes, pag nawala, if they mutate, so the number one cause of cancer is the mutation of the gene. Now remember that a normal gene will cause the normal signaling pathway. But if the gene has mutated because of the environmental factor, then it will contribute to the development of several types of cancer in the human. Example, the human cancer tumor growth factor beta is mutated in some cancers in the colon. So, sa cancer sa colon, that is tumor growth factor daw na siya. SMAD4, a key intracellular signaling protein in the pathway which is often inactivated in cancers of the pancreas and some other organs. So you see, these are the genes that are involved in the cancer of the colon involving the tumor growth factor beta. The tumor suppressor RB gene controls a key point at which cells decide to enter the cell and to enter the cell cycle and replicate the DNA. So remember that the cell has to decide to divide the chromosome into two. Before they do that, they have to activate the tumor suppressor gene. Because the tumor suppressor gene or the RB gene controls the key mechanism at which cells decide to enter the cell cycle. This is the cell cycle. Ito cell cycle ito. No? And they decide to enter the cell cycle and replicate their DNA. RB gene therefore serves as a breakdown ng RB gene in our body serves as a brake that restricts the entry into a space in order to prevent the doubling of the damaged chromosome. So the Lord is so good. Kanang ImuRegen natin, why is it that our ImuRegen is very effective? Because it contains these RB genes that will now control it restricts the cell to enter into a space when there is a damage. Bakit i-restrict niya? So that the damage will not be doubled. Because if that RB gene is not activated, then the damage will be duplicated. Then the more it will cause a damage, and the more that the damage is magnified if the RB gene is not activated. So let us be thankful that, so I can surmise that our ImuRegen content, our ImuRegen bottle, contains a lot of these genes, factors, proteins that control the behavior of the cell. So RB gene serves as a brake that restricts the entry of the space if there is a damage to the DNA. By binding to an inhibiting gene protein, this is actually the EF2 factor family, which are needed to transcribe genes that encodes the proteins required to entrance to the S phase. So the proteins to require for the doubling of the chromosomes is requiring the activation of E2F. E2F family is needed to transcribe the gene that encode for the proteins required into S phase of the cell cycle. So if that is not controlled, so let us be thankful that our ImuRegen has the capability to make straight these proteins that are very important in the control of the development of cancer. So here is an example, no? P16, for example. The P16 is a cyclin-dependent inhibitor. A cyclin-dependent kinase, cyclin-dependent kinase, it is very important for cell division. So the CDK acts on the G1. By the way, G1 is gap. G stands for gap. So gap 1, gap 2. Rest number 1, rest number 2. So during gap 1, okay. Yung cyclin-dependent kinase 4 complex, an inhibition of a gene regulatory protein, RB gene, and the EF2 factor, a gene regulatory protein, which will provide the transcription of the target genes that control the entry to the S phase of the cell cycle. So this is one control mechanism. So you look at the RB gene, no? The RB gene is very important in the transcription of genes that control the doubling of the chromosome. So every time the DNA is doubled, is controlled by this RB gene. When there is something wrong with this, then it will actually cause cancer. So wala siya. So when there is something wrong with that, then it will develop what you call the retinoblastoma carcinoma. Okay? So wala siya, no, resulting cancer behavior. Another example. Grabe good, no? This is really the molecular biology of cancer proliferation. Grabe itong topic na discuss natin ngayon. This is pang PhD talaga ito. Actually pang fellow sa oncology. This topic is only discussed by fellow in oncology. If you're a fellow in oncology, then you know this. But if you're an ordinary doctor, this is very difficult. How much more if you are not a doctor? Huh? Pero overall, ako i-summarize na lang para hindi kayo masyadong malilito. Ang role ng ating ImuRegen is to make straight for these genes to function properly so that it will prevent the occurrence of the cancer gene. Did you get the idea? So what is the RB gene? Ang importance sa RB gene? Many cancer cells proliferate inappropriately. So what do you mean by that? Means they don't divide regularly. So if your DNA, why is it that your cell does not divide regularly? Because you lack nucleotides. That's why in the homeostasis of life, nucleotide balancing or the sufficient supply of nucleotide is always the basis of the mother of all therapeutic mechanisms. Para madaling magamot ang pasyente, kailangan supplyan mo talaga siya ng nucleotides. Kasi dyan sa supply ng nucleotides, it will straighten up all those genes that function. So look at here. Many cancer cells now proliferate inappropriately. So they don't divide regularly by eliminating the RB gene entirely. So many carcinogenic substances from the smoke, from the food preservative, from the pollution, from other contaminants, actually destroy the activity of the RB gene. Because others achieve the same effect by acquiring mutations that alter the components. If the components of RB genes are destroyed, then it will develop what we call retinoblastoma cancer in the body. But that can be prevented. And remember that retinoblastoma is a cancer which is also of the epithelial nature. That means pwede sa colon, pwede sa uterus, pwede sa baga, and so on and so forth. So itong mga cancer na genes na ito, nandito na sa ating katawan. All we have to do is make these genes function naturally so that they will not develop into a full-blown cancer. Did you get the idea? And that is only prevented because of the epigenetic regulatory system that is built in our ImuRegen pattern. Good or very good? Very good. Look at it here. Itong, di ba, EF2 kanina, expression of the S-phase is inhibited if there is a damage to the DNA. So, but if the cell is normal, then this particular active RB gene will now be allow the S-phase or allow the, so if this is normal, the cell will be able to divide normally. If the cell has a damage, then it should inhibit the proliferation of the cell. This is the meaning of this particular diagram. This is another one we have. Itong mga receptor na to, nasa skin mo na yan, skin. It's either activation needed to drive the cell cycle or activation needed for the nutrient uptake and utilization so that the cell will grow. So, those are growth factors. Mayroon na yan sa skin natin. Galing sa environmental, sa cell membrane. So, mayroon na yan, mga receptor na yan. So, it's either the receptor is a receptor mitogen or a receptor growth factor, and down the line to achieve what you call development of a normal cell growth and development. So, lalong, masyado na itong technical talaga, no? Hindi niya naman retain, pero ang isa lang ang, ito, tingnan mo pagkain. Pagkain natin nagiging asukal. Yung nagiging asukal, pag-increase ang glucose transport, increase din ang glycolysis, increase ang energy production in mitochondria, and of course, excess in the citrate due to the Krebs cycle will result to the production of acetyl-CoA, and of course, the synthesis of cholesterol, isoprenoids, and build-up of membrane for the normal growth. So this is the normal pathway yan. Yan, mga yan ay mga adult pathways controlling the membrane biosynthesis. Remember that membrane biosynthesis is the development of our membranes. Siya, and this is one. So, if there is something wrong with this, then it will develop cancer. So, ang cancer is actually, diba, two sides of the same coin lang na siya. Sinabi mo. Okay, pilisan na lang natin. Mutations in genes that regulate apoptosis. What is apoptosis? Program cell death. Natural death. Apoptosis is natural death. So pag namatay ka na natural, ang gagawin sa iyo, hindi necrological. Apoptological service. Tandaan mo yan, ha? Normal death. Pag normal death, apoptological. Pag sa sakit, necrological service. Nakuha niyo na idea ang difference. Pag namatay sa sakit, necrological service. Pag natural death, apoptological service. Nakuha niyo? Nagets niyo? Okay. Many mutations in genes that regulate apoptosis allow cancer cells to survive. That's why ang cancer cell nga nag-mutate allow the cancers to survive mo na hindi na sila namamatay. Kasi apoptosis is natural death. A cancer cell lost the ability to have a natural death. Ayaw niya magpakamatay. Yung cancer na yan, maski very talaga stubborn talaga yan. Ang cancer is a stubborn cell. It has lost its ability to undergo apoptosis. Control of cell numbers depends on maintaining the balance between cell proliferation and cell death. So, pag ang on a daily basis, kung 90 billion cells that are dying, there are also should be 90 billion cells that should grow today. So dapat balance. May namatay na 90, may nabuhay na 90 again. Pag sumubra yung namatay kaysa na buhay, it will lead to cancer. Okay? So, mas maraming cells sa G1 kaysa S phase or sa M phase and G2. So, this is the cell cycle, M phase and the S phase. So, may mga checkpoint dito. So, is all DNA replicated? Is an irreversible where there is a G2M checkpoint. Before they enter into mitosis, there is a checkpoint. I-check nila kung walang error. Kung may error, then they will stop. Kung walang error, then they proceed to cell division. Then it will, dito mayroon din tinatawag na another checkpoint. So sa katawan natin may mga checkpoints. Pero cell cycle natin may checkpoint. Mayroong checkpoint sa before entering the S phase, may checkpoint. Kung ready na ba ang cell to undergo duplication of chromosome, there is a checkpoint. Therefore, this checkpoint is actually checked by the components in our ImuRegen bottle. That is why our ImuRegen is really notorious of being very effective for control of tumor growth. Did you get it? So a lot of our ImuRegen factors have the ability to check the checkpoint before S phase. Anong sabi natin sa S phase? S phase is the phase of the DNA duplication. So before i-double niya, i-check mo na kung walang damage. Kasi kung may damage, tapos i-double mo din, yung damage double din. Di ba? Nakuha mo? Nakuha mo? So ang katawan natin mayroong checkpoint. And this checkpoint are provided by factors that are provided in our ImuRegen bottle. So ganito ka-powerful yung ating ang ImuRegen, no? It has the ability to check on both points. There are two checkpoints. Ano yung checkpoint ng dalawa? Checkpoint dito before sila mag-divide during G2 and M. G2M checkpoint before sila mag-divide. Tingnan nila kung mayroon bang error o wala. Kung walang error, then they proceed to proliferation. Dito naman sa checkpoint ng in G1 before entering S2 o S phase, meron ding checkpoint. So may checkpoint sa M, may checkpoint sa S. So these checkpoints assures that our body will be able to prevent the occurrence of cancer cells. Did you get the idea? So that is how important our ImuRegen content. So this is a cyclin-dependent kinase. As I have said, this is the pivotal protein in the control of cell division. Because cyclin-dependent kinase are proteins that are involved in cell division. So many ang level sa cyclins. Cyclin sa G1, cyclin sa S, at saka cyclin sa mitotic division. So, S-cyclin is abundant from G1 up to the end of M phase. M-cyclin is only abundant during the G2 M phase, and the G1 cyclin is during before the chromosome is doubled. So these are the different levels of cyclins. These are levels of proteins that will involve the control of cell division. So there are major cyclin vertebrates sa tao. These are the vertebrate cyclin and the CDK partner. So these are the genes that are involved. So hindi na lang natin yan kasi lalong malito kayo. Basta ang message ko lang dito sa message na ito is that sa katawan natin, mayroong mga protein for inactivity of the cyclin-dependent kinase. There is also the partly active cyclin kinase, and there's the fully active CDK in order for the proliferation of the cell or cell division. So muna siya. So mutations in apoptosis control genes usually account for this resistance. One protein that normally inhibits apoptosis, one protein, remember this one protein that inhibits the apoptosis is BCL2. Basta maka-encounter mo na sa journal, no? BCL2 is a gene that normally inhibits apoptosis, meaning to say that this is active in cancer cells. Overexpression of BCL2 genes allows the B lymphocyte or the B cell to survive when it should have died. Kasi the white blood cell na B cell, pag nakain na nila yung bacteria, mamatay sila. Pero pag nag-cancerous na sila, hindi na sila namamatay. Overexpression of BCL2 gene will allow the B cell to survive and therefore cancerous na yan. No? So those are the indicators. Nakuha nyo? Nag-guess nyo? Okay, mutations in the P53. Dito na tayo sa P53. P53 gene allow many cancer cells to survive. So pag nag-mutate yung P53 gene, ang cancer mag-survive. Despite DNA damage. Why is this critical? The answer lies in its multifaceted function in the cell control. In an apoptosis and in maintenance of genetic stability, all aspects of the fundamental role of P53 in organism in protecting against consequence of cell damage and the rest of cancer. So ito ngayon para simplify ko lang. P53 will appear into our cell. Kung normal ka at protected ka ng ating ImuRegen, lalabas yung P53. Anong purpose ng P53? In order to prevent the proliferation of a damaged DNA. That is the role of P53. Ano ba ang role ng P53? Hindi lang niya pahinto yung cell division. Hindi lang niya ipahinto ang replication. I-undergo pag niya, i-activate niya ang repair enzymes. So that after the repair, then that's the time na ipatuloy niya yung DNA synthesis in order for the cell to divide. Because remember, complete synthesis of DNA is a prerequisite to cell division. So pag nag-mutate yan, hindi na niya kaya na ipigilan ang mutation or damage. So yun ang role. So ang role ng ating ImuRegen, lalo na pag mayroon ka ng cancer ganon, nag-mutate na yung P53 mo, kailangan mo ng supply ng exogenous na P53 na galing sa ImuRegen. Kaya nga kailangan mo mag-take talaga ng ImuRegen. Kasi damage ang iyong, mutated ang iyong P53. So pag nag-mutate yung P53 mo, nawawala na ng ability ang cancer na mamatay. Hindi na siya namamatay. Pero pag na-activate ang P53 mo, mamamatay siya. Nakuha nyo? Agets nyo? Mahirap talaga itong topic natin, no? Look at it, oh. Hyperproliferative signals, stable, active P53. The stable, active P53 will lead to the cell cycle arrest if there is error, the control of senescence, and control of cell death. Muna siya. So DNA damage activates the P53. Telomere shortening will actually activate P53 and hypoxia. Hypoxia is low level of oxygen. Low level. Bakit nag-low level oxygen? Kasi ang cancer, mabilis kumain, mabilis maggamit ng oxygen. Nauubusan ka ng oxygen, kaya kung cancer ka, mag-hypoxia ka. The more that you have hypoxia. Because cancer consumes more than half of the oxygen that is consumed by a normal cell. Matakaw sila. Pati pagkain. So in contrast to the RB gene, most cells have very little P53 protein under normal conditions. Although protein is synthesized, it is rapidly degraded. Moreover, P53 is not essential for normal development. Indeed, when cells are deprived of oxygen, pag wala kang oxygen, or exposed to treatments that damage the DNA like radiation, or chemotherapy ka, they raise their concentration of 53 by blocking the degradation of this molecule. So, kung nag-X-ray ka, at saka kung chemotherapy ka, magkaroon ng elevated levels of P53. So, one of the things, kailangan mag-expose din kayo ng araw every day, at least 30 minutes a day. By exposing your body to sunlight at least 30 minutes a day, you are activating your P53. That will prevent cancer growth. Amen or amen? Amen. Maganda or napakaganda? Okay. Accumulation of P53 is seen also in cells where oncogenes, RAS, and MYC are unusually active, generating an abnormal stimulus for cell division. Similarly, when telomeres get too short, di ba pag na-exit na yung telomere, mamamatay na yung cell. Pag na-exit na yung telomere, undergo na for apoptosis. So, when the telomeres get short, P53 is activated para to prevent apoptosis. Inhibits further cell division, producing phenomenon called replicative cell senescence. So yan, para i-overcome niya yung senescence. The protection of P53 provides the reason why mutations that activate RAS and MYC are not sufficient to create a tumor. So muna siya. So muna ang mga mutations that occur, no? In the chromosome. Mayroong mga, ang chromosome pwedeng pag naputol, pwede sila mag-connect, kaya magkaroon ng mutation yan. Ang mga chromosome, kailangan talaga may telomere sa dulo. Kasi ang telomere will prevent the tangling of the chromosome para hindi sila magdikit-dikit. Pero pag nawala yung telomere, because of the lack of P53, then it causes the tangling of the chromosome that leads also to tumor, and that leads to damage of the DNA, and it will cause cancer or tumor. Did you get that? So, DNA tumor viruses block the action of key tumor suppressor genes. Mayroon mga tumor suppressor genes. Alam mo, ginamit ngayon na tawag ito, yung vaccine, yung di ba, DNA. Kasi alam nila na yung DNA na galing sa virus, pwedeng makapasok sa tao. Kasi ang virus mayroong abilidad na mag-replicate sa loob ng katawan, tapos ipapasok nila yung sarili nilang gene dun sa atin. Yun ay tawag na DNA tumor genes, no? The DNA tumor viruses. Yung mga viruses sa DNA, pwedeng makapasok at magiging inducer ng tumor. We call it the DNA tumor virus. The DNA tumor virus block the action of the key tumor suppressor proteins. The DNA tumor viruses cause cancer mainly by interfering the cell control on the cell cycle and apoptosis, including that of P53. There are two pathways of the host, either lytic. Lytic cunning is they get inside, they develop, and then putok yung cell dahil nag-saturate na. Ang lysogeny is they get inside, pasok sila sa DNA, sa cell mononucleus, doon sila mag-connect sa DNA natin. When the cell divides, they are inherited. Ito, when the cell divides, they are inherited lysogeny. So it could stay there like HIV. 70% sa HIV is lysogeny. Pwedeng makuha mo yung HIV ngayon, nandiriyan sa katawan mo yan hanggang sa generation mo, lysogeny yan. Pero pag pumasok ang virus, tapos nag-proliferate sila sa pastor, and then nag-burst yung cells na infected, yung infected cells, magkaroon ng maraming cells yun, shedding off, and then nagkaroon ng contamination. Yun ang lytic cycle. So there are two infective pathways of the virus, either lytic or immediate. Yung lytic is immediate, while lysogeny is actually inheritance from generation to generation. Did you understand that? Okay, so we're almost over. So in papilloma, the viral genes, papilloma virus is a virus that induces the papilloma cancer. So mainly to blame are called the E6 and E7 genes. The protein products of these viral oncogenes interact with many host cell proteins, but in particular they bind to the key tumor suppressor of the host cells putting them out of action and permitting cell to replicate DNA and divide in uncontrolled manner. That's why it will develop cancer. So E7 protein prevents RB gene from binding and inhibiting the E2, which we mentioned earlier, that allows the uncontrolled entry to the S phase of the cell cycle. The other is P53. By binding to P53, the viral E6 protein triggers P53 destruction, allowing abnormal cells to survive, divide, and accumulate, yet more abnormal cells will come out. So yan ang mga consequence, no? So ladies and gentlemen, those are all about the misbehavior of cancer cells, which can be controlled by the genetic factors that are present in our ImuRegen matter. Thank you very much and good afternoon. Did you understand? Medyo mahirap, no? Medyo mahirap, pero naintindihan ba? Yes. Nakakuha ba? Yes. Did you learn something? Yes. So, mayroon na tayong huwag kayong magsabi na walang cancer gene. Mayroon ng cancer gene sa katawan natin. It's only a matter of either expressing the proto-oncogene or expressing the tumor suppressor genes. Yung factor na yan, nandiyan na yan lahat. So thank you very much. I hope that you have learned something today.
I have one student in called Julius Verdadero. He is the professor way back in college at FSU.
Sinasabi?
Si Julius Verdadero.
Verdadero? Oo. Sabi daw niya?
No, he was just...
Professor daw niya ako. Yes.
Okay. Thank you very much, Doc. Nakakahirap ng topic pero ginawa niyo magaan. Para sa amin. Thank you po. So, ang tanong ko lang po, so maliwanag yung closing nyo misbehavior ng cells. But the bottom line is, ang ina-address pa rin yung gene.
Gene pa rin.
Okay. So, yung P53 po is now prepared as ImuRegen.
It is in our ImuRegen battle.
It's part in the ImuRegen battle.
Yes.
Ngayon, kanina po kasi parang nabanggit niyo, it is preventive. Pero what if ando na po yung cancer? For treatment din po ba yung ImuRegen?
Oo nga, kasi pag may cancer ka na, ibig sabihin, yung katawan mo has less ability to produce P53 already. So therefore, it requires an exogenous supply. Kailangan mo ng galing sa labas para maprobayaran ka ng hindi kaya ng katawan mo.
Okay, thank you po. So ganito po, halimbawa po yung pasyente, nag-undergo na ng 12 sessions of chemotherapy. First session, kasi po, one protocol consists of 6 sessions. So, yung isang protocol po, iba yun na parang hindi ko maalala yung pangalan. Pero yung pangalawa, Abraxil, yung po yung another 6. Ngayon po, because after the PET CT scan, very minimal yung decrease ng mass. Opo. So ngayon, now we are waiting for gene therapy. So ano pong pinagkaiba ng gene therapy? So that's another protocol na naman compared with yung taking in ImuRegen. So if we are expecting a gene therapy and we take ImuRegen now, will it affect kasi parang naghihintay kami ng qualification. So, siyempre gusto rin po namin ma-avail yung gene therapy. Pero if we take the ImuRegen now, and we will have to undergo para qualification ng patient to be treated using gene therapy, makaka-apekto po ba yun?
Opo. Actually, yung gene therapy is the same as that of P53 therapy. Ano yan? Gene therapy is a kind of intervention wherein a particular gene is activated or overexpressed, either overexpression or underexpression of that gene, depending on the case, in order to prevent the proliferation of the cancer and excite what you call the apoptotic pathway of the cancer. Kasi ang cancer, nawala na siyang abilidad sa apoptosis, hindi siya namamatay. Yung gene therapy na yon para pigilan yung kanyang resistance sa apoptosis para magkaroon siya ng activation of caspase gene. The caspase gene are very important in activating the apoptosis in the mitochondria. So yun ang gene therapy. So bakit hindi ka na maghintay na lang doon ng gene therapy na yun? You go direct to ImuRegen intervention because ImuRegen intervention is even far better than gene therapy.
Okay po. So pwede siyang combined treatment.
Pwede naman po.
Hinihintay po talaga kami sa inyo.
Pwede naman po. Pwede naman po.
So yun ang concern namin na while waiting for that gene therapy, can we take ImuRegen?
Very well, very well. As a matter of fact, yung binasa ko, binasa ko na itong ImuRegen therapy are normally administered after chemotherapy. Hindi pwedeng isabay.
Yes, opo, tama po. Kasi nag-undergo na po ng 12 sessions of chemotherapy. Now we are awaiting for gene therapy. Opo, pero wala po kasing specific date. Now I heard your lecture. Kaya ang tanong ko nga po, will it affect na if we take now before the gene therapy, may implication po ba yun? Or we wait after the gene therapy, then we take ImuRegen?
Mas maganda nga kung take na kayo ngayon para yung gene therapy na i-apply sa inyo sa kanila, it will be more efficacious because it's already guided by the ImuRegen factors. Remember that our ImuRegen factors are the guide for cell restoration. So, ang kagandahan itong ImuRegen natin kasi self-diagnosing siya. Alam niya kung saan ang error, kung alam siya papasok, saan siya papasok. Because our ImuRegen has the versatility to detect where the error is and to restore the cell to its normal function according to the epigenetic homeostatic condition of the body.
Opo, so ano siya, selective, targeted ang action ng P53.
Correct.
Opo.
Yes. Kaya nga po,
sorry po ha, sino mas tala na namin magtanong.
kaya nga po yung sinasabi ng wife ko na kasi po sa qualification, tinitingnan baka mamaya maka-apekto po. Hindi naman po kung halimbawa nag-take nga po ng ImuRegen. Tama po na? Na gano'n, hindi po ba makaka-apekto yung halimbawa yung patient ay
Mas maganda pa.
detect po, parang gano'n. Kasi
kung nag-take siya ka ng ImuRegen, mas maganda ang outcome ng diagnosing later on. Makikita doon na baka magtaka ang doktor, uy, bakit ito na-restore?
Yes.
Samantalang hindi pa tayo nagka-undergo ng gene therapy.
Ayun po.
Yun na. Kaya ang ImuRegen has the advancement. So, what I could say is taking ImuRegen now prior to that gene therapy is a lot better intervention because it will actually straighten up the pathway for the normal cells to take place. Yung homeostasis kasi. Ang function kasi ng ImuRegen is homeostatic, epigenetic, restoration of the normal function of the body. So kung nag-take kayo ngayon, then the more it will be better because later on, when there is now a proper diagnosis for them to implement their regimen, they will now mamangha sila na, uy, bakit naman ito? Mukhang maganda na, hindi na yata may kailangan.
Kasi sabi nga ng doktor, ang humingi sa doktor mo na baka meron kami bigay sa amin na na tawag dito, medicine Kasi nga yung patient hindi na siya natapos niya na yung 12 sessions and then about 2 months ng ganyang hindi nag-session ngayon humihingi ng medicine para maka ano doon sa may tawag ito. Hindi masyado dahil wala ng therapy nga nangyayari doon sa patient. So humihingi ng medicine to prevent further kung ano man ang nangyayari doon sa group ng kanyang liver, sabi natin liver mass nga dahil wala ng therapy. Ngayon, sabi ng doktor, di ka muna bibigyan dahil baka mamaya maka-apekto pagdating sa may blood test nga. Kaya nga, minsan sa amin, hintay muna natin na pag may gene therapy na, yung GT nga, saka kami magbibigay ng medicine na yan. Pero po kung once na nag-take ng ImuRegen nga prior kung sa may blood test, hindi ko ba makaka-apekto yun?
Walang kasama doon pa, kampante nga ako dahil sabi nga doon sa grupo ni Racus na yung ImuRegen is very notorious of preventing cancer tumor growth. So ibig sabihin, pag nag-take ka nito, then it will straighten up itong mga different pathways, signaling pathways that will restore your body to normalcy. So any abnormality the background prior to preventing their own genetic therapy, tapos nag-ImuRegen ka, better pa nga. Kasi later on, pag nag-diagnose na sila sa usually kasi yung mga gene therapy na yan is both diagnostic and therapeutic in nature. So, kung i-implement nila, then magtaka nga sila, uy, bakit ba ito mas maganda na ang situation niya? Na kung maganda yung regimen nila, then the more it will synergize with the activity of ImuRegen. Because ImuRegen, the aim of which is to restore the normalcy of the signaling pathways of the cell inside our body.
So in short po, maganda pong mag-take na prior mo sa GNT na yun. So wala pong complication.
Walang complications, walang conflict.
Okay. So yun lang naman.
Pwede pong follow up.
Sige po.
So yung ImuRegen po na P53 is a gene.
It's a protein.
Protein po. Ano po yung source ng protein?
Protein is galing din sa nucleotides yan eh.
Animal protein, plant protein,
No.
hindi siya chemical.
P53 is a protein derived from the central dogma of life. Hindi yan si chemical. Protein talaga. Galing sa amino acid yan. Galing sa amino acid.
Kasi naalala ko lang yung introduction nyo kanina na ang collagen from animals, bawal.
Ang collagen sa animal, yun ang nagiging collagen sa cancer o tumor.
Opo. Ngayon, naalala ko pinopromote kasi chicken feet as source of collagen. Yung mga ganun po ba?
Chicken feet?
Opo, as source of collagen.
Chicken yung Adidas?
Opo.
Source of collagen.
Kaya maraming bumibili talaga, ako kasama ko sa nag-o-order.
Huwag kayong mag-subscribe doon kasi ang findings ko, ang protein, collagen from meat are the same protein collagen that is found in cancer. So ang tanong mo ngayon kung saan na-derive yung P53? Ang atin, galing yan sa bovine source. Bovine is Carabao, cow. Yun ang source ng P53 natin. Animal pa rin, pero at the molecular level, molecule na siya, hindi na siya bago. Wala nang distinction. Kung ang molecule magiging, at molecular level, pareha na. Adenine is adenine whether it is come from plant or animal at the molecular level. P53 is P53 whether it is from animal or from a plant at the molecular level.
So, molecular level, although in this case, ano pala yan?
Although it is derived from baka, although it is derived from baka, but at molecular level, they are all universal in nature.
Thank you po. Pwede po ba last na lang? On the preventive side of ImuRegen, ako po kasi may multinodular goiter. Kaya na-imagine ko yung explanation nyo kanina sa FNAB. Several times na akong na-FNAB, din na mabibilang ng delivery ko. Kaya sabi ko, siguro kaya nagiging lalong multinodules. So it's not cancer, thank you Lord. Tuwing naman kinukunan ako binay. Although lagi nakalagay highly suspicious. Ang tanong ko po, yung ImuRegen po ba nakakatanggal din ng nodules ng goiter?
Definitely, of course. Definitely.
So may mga case na po na mga
Yung experiment kanila, yung tumor na pinakain nila ng origin na matay, yun in vitro yun. In vitro that means sa tissue or sa release. Then, normally, the same thing will happen with in vivo. So kung ano na dyan ang nodules, ibig sabihin, uminom ka, in vivo yan. That means, either in vitro or in vivo, it has the ability to regress the tumor or nodules.
So, bali yung preventive side and treatment side, okay ba lang po ng dosing? Opo. Okay. Thank you very much, Doc.
Thank you.
Between this stage ng cancer, stage 1, stage 2, stage 3, stage 4, different dosage, ano yung time frame nila that they can see results?
Halimbawa po, stage 4.
Stage 4.
Ang stage 4 kasi talagang mahirap. Kasi ako, pag stage 4 na, it is the time wherein the cell has no ability to produce p53. That's why it refuses to die. Kaya nga, it refuses to die kasi wala na siyang ability to produce p53.
So, ang ImuRegen po, hindi pwede sa stage 4.
Pwede naman, pero yun na, miracle can only happen, only God knows. Kasi ang pinaka-fundamental principle talaga ng ImuRegen is it activates our own system to repair itself. Because when God created man, He created our body that has the ability to heal itself by activating all these normal mechanisms that we have in our system. Yung mga i-discuss ko kanina, normal yun. Na kung mag-abnormal, it will go to the same side at the same point. Diba? O different side at the same point. So, ibig sabihin, yung mga advanced stage na talaga, pagdating na sa stage 4, kasi ang nakita ko doon sa stage 4, maski na irradiation mo pa yan, maski na i-chemo pa mo, hindi pa rin siya namamatay. It has lost the ability to take control of the P53.
Hindi ko lang Doc alam po, kung meron po American doctor dito. Ano po ba ang criteria para sabihin stage 4 ang cancer? Is it the size of the mass? Ano po yung main criteria?
Yung kanina nakita niyo yung main criteria niya, 10 to the 9 cells palpable. 10 to the 12, patay na. Ibig sabihin, may criteria yan. Pag nakita nila sa microscope na masyado makapal yung nucleus, kasi ang nucleus ay yun ang dark stain. In the cell of our body, it is the nucleus that is dark stain. Meaning to say, the darkening of the dark color of the nucleus is due to DNA. Ngayon, pag ibig sabihin niya, pag cancer na siya, dark stain siya, ibig sabihin, masyado nang marami siyang chromosome na na-damage. So, pag nakita nila na, uy, grabe ka, yung very dense ang kanyang color. Stage 4 na ito kasi ang mga doktor kasi meron na silang standard for stage 3, stage 2, stage 4. Pag nakita na ganitong kulay, ganitong itsura, morphologically, meron na silang criteria, stage 4 na yan. Although hindi nila alam at molecular level, pero pang stage 4 at molecular level, the cell has the no more capability of producing P53. Remember that it is P53 that will control the cancer cells. Wala na sila eh. So wala na. Wala ka nang magawa.
I remember there was one person dito na testimony that he was an old Chinese guy, recruited by Pastor King, and remember it right, his prostate cancer was stage 4. What he did, instead of taking ImuRegen in 20 days, he took it in 3 days. Anyway, there is no overdose by taking it so much.
So, ilan ka na marami?
Oh, but marami. He's taking too much. His stage 4 cancer was gone. He was in the
May pasyente ako sa Dubai noon na talagang ano na siya,
Pastor, can you
very advanced cancer na.
Kasi may mga tao tayo sa sumaya.
Very malignant. Tapos, Umuwi siya from Dubai, i-treat ko siya ng megadose of yung at that time, iba pa yung anti-cancer regimen ko. Nagtaka yung bale, nagpunta siya dito, no, para i-treat ko kasi ayaw niya mag-opera. Finally, bumalik siya sa Dubai kasi lumiit na yung tiyan niya. Pero dahil kay discomfort siya at saka hindi daw siya makatrabaho, balik ulit, kailangan niya mag-opera. Nung nag-opera, nagtaka yung doktor, bakit itong biopsy na result na prior to operation, very advanced. Pag-click ko dito, yung malignancy, high-grade malignancy was downgraded to benign. So, ibig sabihin, mangyayari pala yan, pwede pala. Only God knows, no? Stage 4 na yun eh. Highly malignant, tapos nag-revert into benign. Ibig sabihin, mayroong intervention ang nangyari. Yung sinabi mo, nag-dose, nagkaroon ng intervention, and there is a positive feedback, and there is now a restoration of the normal genes of the cells that are supposed to take your signaling system in order to restore the cell to normal activity.
In a sense, recap ko lang to. Share, I just requested to, para kasi yung mga nasa Zoom, hindi na rin. Yeah. But in short, there's no overdose of taking because it's just a food supplement. Yeah. So you can take as much as you can. It depends on what stage are you as a cancer stage. Correct. And in that, possible with much prayer, with God's intervention, it is always possible. Even stage 4 has a greater probability. Only God, with God, it can be done. Yes. Can you repeat what you were just sharing for people in Zoom? Because we have 50 plus, 60. Yeah, in short, Doc, and the Chinese guy, there is no overdose when it comes to taking ImuRegen, regardless of what cancer stage it does, because it's just a food supplement, and that there's a greater probability that in a cancer stage, stage 4 cancer person, client, patient can still be healed. With prayer, it can be done because we have heard testimonies that it's being done. As compared to chemotherapy or radiation, that very little probability, almost zero probability that I heard. No more chance. But here in this case, we have heard stories, and with that probability, there's a greater probability that the ImuRegen has a greater probability of healing even stage 4 cancer patient. Glory to God. Thank you, Doc. Yeah. There's a question here sa Zoom. Doc, may tanong ako, paano absorb yung protein kung may sira ang kidney o albumin? Mare-repair ba ang kidney sa pamamagitan ng kidney? Yeah.
If we follow the principle of cell restoration, ang hindi lang naman cell, ang cell na hindi na repair talaga are the neuronal cells, and talagang once damaged forever. Ang ko lang ganito. May isang tao doon sa Putang Pinapawan, hindi na siya makaihi. Ibig sabihin, sira na yung kidney niya. Sira na yung kidney niya kasi ang kidney lang ang gumagawa ng ihi. Now, why is it that after finishing one bottle of ImuRegen, yung kanyang ihi na 5 ml na lang, after finishing one bottle of ImuRegen, umabot na ng 1 liter of ihi. Ngayon, ang tanong ko ngayon sa sarili ko rin, ano kaya ang nangyari doon? Ang kidney ba ng taong yun ay sira or something just wrong with the kidney by taking ImuRegen na correct na kaya bumalik yung function ng kidney niya. So hindi ko lang alam kung alin doon. Kung totally damaged kasi, highly specialized organs have difficulty in restoring it to normal actually. But in our experience with cell growth and development, sa experience namin, yung mga highly, not so specialized cells, are easily recovered. Like ang blood cells, although specialized, pero ang blood cells pwedeng makorek. Kaya ang bone marrow transplant is very possible for correcting mga leukemia, ganun. So, hindi ko lang alam kung yung kidney, kung na-restore yung kidney, kung totally damage talaga ang kidney, mahirap talaga. Kasi ang tubules are really specialized cells. Pero pag nasira, something is wrong lang with the membrane, yan, baka nasira lang yung kanyang ion exchange ba? Yung water and ion exchange, baka nasira lang. Pero by taking ImuRegen, na-restore na yun, kaya bumalik yung, kasi ano man explain, wala man ako ibang explanation bakit bumalik yung ihi niya sa normal.
Kasi di ba Doc, meron na yan?
Only kidney transplant can do that, actually. Oh, yung mga hindi na makaihi, only kidney transplant could restore it to normal ihi formation. But why is it that after finishing one bottle, bakit nakaihi siya?
Kasi Doc, ngayon,
Ang ano ko lang, ang idea ko lang doon, na baka maroon lang something is wrong, hindi talaga totally damage yung kidney niya, pero lang siguro ion exchange, mga problem doon sa membrane ng kidney niya, sa glomerulus or kaysa sa distant tubule o sa loob ng henle, na na-restore ng ImuRegen, kaya bumalik yung ihi production.
di ba Doc, almost million na kayo na nagtadialysis.
Marami na.
No, ganyan. So, hindi lang natin alam kung pwede subukan ng ImuRegen talaga.
Kaya nga ang akin is, kaya nga, even in this COVID case, kung ang government was just resolute on our recommendations to use ImuRegen, it could have already stopped all these transmissions long time ago. Kung si Duterte nag-resolve pa, kasi pinarating namin sa kanya, ako mismo sumulat na dapat i-mandatory niya ang distribution ng ImuRegen to prevent COVID. Kung ginawa niya yun, baka ngayon wala na talagang COVID case. Kaso nga lang, sa paligid niya, ang mga tao ay hindi convinced na ganitong klaseng intervention. Kaya walang nangyari. Tayo lang ang stubborn na hindi nagpa-vaccinate in order to fight and show to the world that the natural intervention in this natural product is a lot superior than any of the drugs or medications available in the market.
Thank you very much, Dr. Oclarit. Pwede pa po. Organic?
By definition, organic is any substance with hydrogen, carbon, and oxygen is organic. So organic yan. Ang minimum ko sa organic ngayon, yung walang fertilizer. Pero any substance na may carbon, hydrogen, oxygen is organic. Sugar is organic. Fat is organic. Protein is organic kasi mayroong carbon, hydrogen, and oxygen component in the molecules. Yun ang definition sa organic. Any substance na mayroong carbon, may hydrogen, may oxygen, may nitrogen, organic yan. Pero ang term ng organic ngayon, sa term organic ngayon, yung manok na hindi pinakain ng feeds. Yung manok, may fallacy dyan kasi manok is organic talaga. Ano nga yung flesh? Any flesh is organic. Pero ang word ng organic ang manok na yan kasi hindi pinakain daw ng feeds, hindi daw pinakain ng mga chemical. In other words, walang antibiotic, walang mga growth factors. Yun ang sabi niya sa organic. Sa rice naman, sa organic rice, ibig sabihin walang fertilizer, walang spray. Yun ang organic. Ang meaning sa organic na yun. Pero may mali yan eh. Mali yan. Misnomer yan eh. Kasi by definition chemically, any substance na may carbon, hydrogen, oxygen, nitrogen, at phosphorus, organic yan. Organic chemistry yan eh. Kung mag-take ka ng organic chemistry, ibig sabihin mag-aral. Ang inorganic, yung mga minerals, inorganic yan. Carbon dioxide is inorganic yan. Oxygen is inorganic. Bakit? Ang oxygen walang carbon. Ang hangin may carbon ba? May carbon pero walang nitrogen. Ang carbon dioxide may carbon at saka oxygen pero wala hydrogen. So hindi inorganic ang carbon dioxide. Ang tubig is inorganic. Bakit? Hydrogen and oxygen lang ang tubig. Ang mineral, may carbon ba? Wala. Diba? Mineral lang eh. So anything na walang carbon, walang hydrogen, walang oxygen, walang nitrogen, inorganic.
Yan ang tamang definition.
Yan ang definition. Ang organic is any substance na may carbon, hydrogen, oxygen, nitrogen, phosphorus, organic. Ang tao, organic. Ang manok, organic. Ang baboy, organic. Ang tubig, inorganic. Ang hangin, inorganic. Yun ang ibig sabihin. Nag-gets nyo? So I hope that you are corrected on that matter. Do not use the word organic na manok kasi organic mo talaga ang manok. Mas baliktarin mo ang mundo, organic talaga ang manok.
Paano po yung sinabi kanina? Yung chicken feet may health benefits?
Mayroon naman kasi mataas ang level. Ang pinaka the best source of collagen talaga is fish. Fish collagen. So, kung gusto niyo magkaroon ng fish collagen, kainin niyo yung kaliskis.
Ay, kaliskis.
Oo, kasi rich in collagen yan. So, yung bangos, huwag niyo tapon yung kaliskis. Kainin niyo. Or kaya, punta ka sa merkado, bili kayo ng 1 kilong kaliskis. Mana, pabili ng 1 kilong kaliskis. Punta kayo, mana ngayon, bakit? Yun ang source ng collagen, sabi ni Dr. Oclarit.
Sabi ko po kanina, last na ako. Pero nagkataon kasi ang topic tungkol sa organic. Magtatampo naman yung opisina na nire-represent ko. Sa Bureau of Soils and Water Management po ako, Department of Agriculture. Okay. And we are promoting organic agriculture. So organic agriculture po, hindi yung manok o ano. So tama si Doc na ang organic is anything from plants or animals. So kaya lang sinasabi natin organic agriculture, ang ginagamit nating pang-fertilize is from waste. Yung mga binulok na organic waste from agricultural waste, from rice straw, di ba lahat ng waste sa agriculture made from animals, chicken manure. So, from animal products or plant products na binulok at ginagawang fertilizer. Kaya organically produced. So, yung po yun. Kasi nandito po ako sa hindi ako nagsalita. Thank you po.
Nilagay lang natin sa proper perspective ba, definition ba. Yung organic farming, ibig sabihin, gamitin niyo yung natural fertilizer na hindi produce sa chemicals. Walang spray, walang chemicals. Sa manok production, hindi siya pinakain ng mga growth factors, walang chemicals, wala silang antibiotic. Kasi ang antibiotic, alam mo, dito sa public health, pag i-treat niyo manok sa antibiotic, it takes 15 days na withdrawal of the antibiotic prior bago ibenta. Paano yung time ng araw ng mga patay, mga fiesta, na uubusan ang supply ng manok, kaya maski na hindi pa pwedeng ibinibenta na, maski na sabi na, meron ako narinig doon sa Mindanao noon, meron akong thesis student sa Doctor of Medicine in Veterinary Medicine. Nag-examine sila sa antibiotic level sa manok. Ako ang advisor. Pero na siya pinunta doon, Dok, alam mo Dok, ang reason na bakit na rampant ang antibiotic resistant na strain sa bacteria. Dahil ang mga bacteria kasi sa manok, the same pa yan mga bacteria sa atin sa tao. Ang antibiotic doon sa manok, the same pa rin yung antibiotic sa tao. So, pag binigay mo sa manok yan, dapat ma-withdraw mo na yung antibiotic 15 days. In 5 days pa lang na sinabi daw na may-ari, huwag ka nang maingay kasi kailangan natin ng benta. So, binibenta, maski na hindi pa natapos yung 15 days na withdrawal period. Kaya during expected holidays, mataas ang level ng antibiotic sa manok. Sa mga lahat ng mga food chain, Kasi nga daw, na-pwersa yung mga producers to sell it. Kaya na-pwersa din naman silang bumibili dahil naubusan ng supply. So, supply and demand, alam mo naman. So, yung ilagay na natin sa proper perspective yung organic farming at saka organic production. Because by definition, any substance na galing sa flesh and vegetables, they're all organic. Anything with carbon, hydrogen, oxygen, nitrogen, phosphorus are organic.
I will explain the difference between Portier and ImuRegen.
Ganito ha, sabihin ko sa inyo talaga, ito point blank, this is actually from the point of view of a molecular biologist. The one who knows, I know what I'm talking about. Okay. Itong yung egg ng tao or egg ng manok, whatever, or bisa maski deer. Pag na-fertilize yan, after 6 days, ma-divide ang cells into 2 groups after 6 days from the day of fertilization. They fertilize ngayon. After day 6, the group of cells are divided into 2. One is known what we call the inner mass cells. This is consists about 300 cells. The rest of that is what we call trophoblast. The inner mass cells of the embryo, yun ang magiging tao. Yun ang magiging part ng tao. Yung the rest of the cells in that egg, fertilized egg, is a trophoblast. And the trophoblast becomes the placenta. And the placenta can never become a hand or a leg or any organ. Therefore, Portier is derived from placenta. Therefore, placental cells are only nourishing cells. They are not stem cells. They are not classified as a stem cell because a stem cell is an undifferentiated cell which later on become a human being or an organ. But a trophoblast cannot become a placental cell. Cannot become because it's only a nourishing cells. And therefore, the difference between ImuRegen and Portier is that a Portier is only a peptide therapy. Kasi nandyan mga peptides lang at saka proteins na nanggagaling sa trophoblast. Na nourishing din naman siya, kaya may mga positive effects. Like, kung kulang ka nito ng enzyme na ito, nandun sa trophoblast. Kasi remember that trophoblast supplies nutrients to the embryo. And trophoblast is the placenta. And that is where the derivative of Portier. In-explain ko na yan sa mga leader nila. Ayaw nila mga very hard-headed. Sabi ko, hindi yan stem cell deer. Pagkaroon ng mishyping pa, misnomer. Because Portier derives the cell from placenta. And placenta is not the embryonic. Does not become the human flesh or it not the organ or nakuha yung diferensya? Yes. I hope that if you have studied, so Portier therapy is the same as peptide therapy. And in the category of therapy, it can also be so at same Portier therapy is the same level as ImuRegen therapy. But superior lang ang ImuRegen kasi ang ImuRegen takes the proteins from all the parts of the organs, whereas in the Portier, they take the proteins only from the trophoblast. Nakuha nyo? So peptide therapy pa rin ang kategory niyan. Peptide therapy.
Maraming salamat, Doc. Papasa ko ngayon to kay Dr. Oclarit para makapagpahinga na kayo, Doc.
Well, we will just summarize. Una, pinag-usapan natin ang cancer. The topic was molecular basis of cancer behavior, and you have seen how it was shown in delicate detail by Dr. Oclarit. And then pinakita ano naman ang role ng ImuRegen. Ang ImuRegen, una, hindi siya drug. Okay? Siya po ay food. Pero as food, it will support the immune system of the body. So on the basis of the immune system of the body, nandun yung inspiration that it will help fight any disease, including cancer. Ang immune system natin, ang lalaban doon. Nandun yung connection. Pero we cannot make a claim that it can cure cancer, it can be used to treat cancer, because first, it is not a drug, right? But as food, will it help? Yes. In what way? Supporting the immune system. Ngayon, pagdating sa immune system, ang nagdidikta sa immune system, DNA, which is present in every cell. Kasi hawak ng DNA ang code of life. Lahat ng instruction ng Diyos kung paano aayusin ang katawan ng tao through homeostasis, right? Nasa DNA. Ngayon, doon sa description ni Dr. Oclarit kanina, yung molecular basis, lahat yon has to happen before the DNA starts to work or before DNA replication. Bago mag-replicate ang DNA, that is step 1 sa central dogma of life, dapat ayos lahat yung didiscuss ng mga different, let's say, actions, right? Dapat ayos yun. Kasi pagka hindi ayos yun at natuloy yung DNA replication, parang yung Xerox copy na hindi na ayos yung original, pag kinopya, pati yung kinopya, hindi na rin ayos. So pag natuloy yung DNA replication na hindi na ayos yun, yun na yung problema. Yun na yung nagkakaroon ng mutation, di ba? Hindi na normal yung cell. So, the good news is that, ano naman ang connection ng nucleotide? Research have shown that when there is lack of nucleotide pool or when there is poor nucleotide biosynthesis, lahat ng mga factors that Dr. Oclarit showed that can lead to cancer will be enhanced. Pagkakulang ang nucleotide, kasi obviously pagkakulang ang nucleotide, mahihirapan na yung DNA, magkakaroon ng DNA replication stress. And that is one of the factors that can lead to carcinogenesis. In fact, DNA damage is one of the hallmarks of carcinogenesis. So naandun yung ating focus, pero hindi tayo drug, hindi tayo to treat cancer. So pag may cancer, go to the doctor, seek proper help. Bahala na kung ano sasabihin ng doctor. Obviously, the doctor will give the best treatment, right? Which could be chemotherapy, surgery, or both, right? Nakuha niya po? Yun ang best. Ngayon, pagdating sa food supplement, what we're trying to emphasize, ang best is nucleotide supplement. Why? Because it will support the DNA. At pag nasuporta ang DNA, hawak na niya lahat. So, ito na po yung ating protocol. Right medication plus right food supplementation. And the right food supplementation is nucleotide supplementation because nucleotide directly supports the DNA. And then, pwede na natin idagdag ang iba kung gusto natin idagdag. Kasi food din po yun. And probably, kagaya ito, this is a third-party study. Walang kinalaman ng kumpanya dito, walang kinalaman ang manufacturer. Pag third-party, they can say anything they want. Tayo, publicly, we have restriction. We cannot say so because our approval is it's food. All we can say is that it is food that will support the immune system. Pero ito, third-party, take note, National Institute of Health, Cell ang title ng journal 2011, Nucleotide Deficiency Promotes Genomic Instability in Early Stages of Cancer Development. And Dr. Oclarit showed the many intricate details of the molecular behavior that can lead to carcinogenesis. And one of the basic problem is kulang ang nucleotide deficiency. O diba sa title itself, maliwanag na yung conclusion. Kulang sa nucleotide, magkakaroon ng DNA stress, and DNA stress, cancer is one of the effects. So, we just simply supply nucleotide, kasi nucleotide pala ang kulang. Pero we did not make a claim na ang nucleotide drug, it's food. Right? It's food that will support the immune system. And then ito po, this is from the Military Medical Science sa Czech Republic. This journal has been present since 1925. O ito, kita mo very specific yung title, A Short History of ImuRegen, an Original Tissue Extract. O yun yung sinasabi ni Dr. Oclarit kanina na we have a lot of epigenetic factors from the bovine tissue extract. Yun na yun. So, may benefit ba sa body? That is the research report. So, tingnan natin yung abstract. ImuRegen is a unique dietary supplement. So, hindi drug. Dietary. It's food. That was developed by leading Czech immunologists. Ano ibig sabihin ng immunologist? Yung nag-specialize sa immunology or immune system. Made and distributed from the Czech Republic and first came out in the 1950s. So matagal na pala itong research na to. Hindi lang ito yung kamakailan lang. Nag-umpisa, 1950s pa. ImuRegen, so very specific, boasts of decades of research and clinical exposure. Pag sinabing clinical, it was tried to human beings. It was created for the immune system. O di ba yung immune system, yun ang lalaban sa cancer. Pero hindi natin sinasabi gamot siya sa cancer. Sourced only from all natural ingredients. So siguro yan, nagsagot ko sa tanong ni ma'am na organic ba yan? Ito, sinabi na nga, natural. Okay, ingredients. That support cellular immunity o immune system ulit. Saan? Sa cell. And the cell is the basic functional unit of the body. If the cells are healthy, you are healthy. If the cells are sick, you are sick. What kind of sickness? Depende lang kung saan yung cell. Cell ng buto, arthritis. Cell ng urinary tract, UTI, and so forth. Energy. O di ba, pag may sakit, humihina. Pag may cancer, humihina. Pag nag-chemotherapy, humihina. Kung makakatulong kaya yung energy, makakatulong. Okay? Tissue regeneration. O di ba? Nire-repair. So kanina yung tanong, the kidney has already been damaged. May pag-asa pa kaya? Usually pag stage 5 kidney, wala nang pag-asa. Kasi nga, halos sira na yung kidney. Ang pag-asa na lang mag-regenerate. Right? Dialysis will not regenerate. But the ImuRegen formula can lead to tissue regeneration, wound healing, endocrine gland, so yun mga hormonal, kagaya sa thyroid. Intestinal integrity, yung microbiome, memory enhancement sa brain, and anti-tumor effects. So kung may anti-tumor effects, makakatulong kaya yun sa mga may cancer? Of course, pero hindi natin pwede sabihin drug siya o kaya na pwedeng pan-treatment sa cancer. Pero as a dietary support, will it help? Yes. So yung anti-tumor niya is under the function of immunity. Kasi yung body natin talaga lumalaban ng natural. So, stage 4 na. So sa stages ganito. Una, yung cancer pwedeng molecular level pa lang. Molecule. At sabi sa Europe ng mga researchers, sa molecular level, pwedeng i-reverse. Kasi molecule pa lang. Ang tawag ng pre-cancerous lesion. Pero pag kumapit na yung sa tissue, so lalaki na. Kinausapan natin, nagiging tumor. Right? Kaya lumalaki na. Yun na yung staging. Una, cancer in situ, meaning the cancer site. Tapos lumalaki, stage 1. Lumalaki pa, stage 2. Lumalaki at mukhang nag-uumpisa ng kumalat. Stage 3. Kumalat na sa distant organs. Stage 4. Stage 5, kumalat na sa buto. And usually, our immune cells are created in the bones. Right? Eh kung mismo yung manufacture ng immunity, parang binarak na niya, na parang wala nang pag-asa. Kaya nga, miracle na lang from God. right? But still, we have to take this as a food nutrient to support the body, to help the DNA to fight to the very end. Nakaya po? Remember, it's food. It's not a drug. But will it help? Of course, it would. O ito pa, another research, epithelium growth sa intestines, regeneration, dietary, ibig ulit ng dietary, hindi drug. It's food. Maliwanag, it's food. But these are third-party studies done in Europe. Marami. I-google lang po ninyo, marami. Pero these are not official statements from us. We are just mentioning them as reference because they are third-party literature. Ours is that it is food. We promote it as food to support our immune system. Will that help? Of course it would. But we cannot make a claim that it is a medicine or a drug to even replace medicine, but it can always be added together as food. So this probably can summarize what we have discussed so far, and we would like to thank our good doctor, Dr. Oclarit, for giving us updates and more information. God bless po sa ating lahat. Francis? Ayos na yan. Ito. Okay. Una, on the topic of regeneration. Kasi di ba regeneration, ang proof in vivo, ito yon. Ginawa sa lower animal sa daga. Yung lower one-third ng intestines, pag tinignan natin yung diagram, pakita mo nga yung, yung histologic exam. Pataas lang yung slide. Ito. Ito, cross-section ng villi ng small intestines. Kita mo, warak, this is the villi, parang ganyan, cross-section. Tapos meron pang microvilli sa loob to increase surface area. Okay? Ngayon, akyat. Nung binigyan ng nucleotide, nakita nyo na nag-regenerate. Okay? Up. Pero pag ang binigay nucleotide, liquid nucleotide, nakita nyo po yung repair. So the liquid nucleotide lumalabas is the best. Kaya kung ako umiinom ng ImuRegen liquid, pinatatagal ko sa ilalim ng dila bago lunukin para it immediately goes to the bloodstream and immediately enter the cell. And then pag dumaan sa ating intestines, ito pa ang repair. So may proof. In vivo study po yan. Merong regeneration. So yun ang pag-asa natin. Actually, what was documented is in the intestines. But that can practically happen in any organ. Kaya lang we should do it as early as possible kasi nga it takes quite a time to repair the organ. The more complex the organ, the longer it takes. Yung small intestines, pwedeng every week. Pero yung mga kidney, liver, baka 3 years. Pagka heart, brain, baka 7 years. Right? Kasi mga complex organs yan eh. That's why, natutuwa tayo sa Europe at sa Pilipinas, pumayag na ibigay at 1 year old ang ImuRegen. So, nakalagay sa label, Europe and Philippines. Sa Amerika, 4 years old and above. Medyo mas conservative sila doon. So the point is, the younger, the earlier, the better. Okay? Okay, so maraming salamat po sa inyong pong pakikinig. Thank you so much to those who have attended our Zoom presentation today. And we're so happy that we have Dr. Oclarit with us here in the corporate office to guide us and give us more knowledge on how our cells behave, especially when it is becoming malignant or abnormal, and how ImuRegen as food can help repair our cells. God bless until our next Zoom presentation.
Okay, so yung mga nasa Zoom, until, okay, next webinar will be, doctor's call will be on Tuesday, Manila, and that would be US, that would be Monday for them. Tama ba? Monday, then Tuesday for us. 10 a.m. So please follow us sa Facebook page namin, Forever Healthy Products. That's where we post our webinars. We have weekly webinars. And by the way, if you happen to be in Manila, we have free medical consultations dito sa opisina from 1 p.m. to 6 p.m. Nag-alternate po dito sa Manila si Dr. Mario and Dr. Arlie from Mondays to Saturday. Okay guys, so maraming salamat. We'll be ending this in 5, 3, 2, and 1. Salamat po.